Good morning and welcome to the second day. Oh, that's good. What a nice way to start. So for those of you that today it's the first day, let me tell you that we just saw this amazing video made by Oscar and Gasper that were finalists on America's Got Talent. Feel free to check them on YouTube, Oscar with a K. Yesterday someone came to check, so I repeat, Oscar and Gasper. Now, for those of you also on the first day, let me remind you or let you know that you have an app, PTMC, available on Google and App Store that you can download where you have all the information about the event. Also, there's a coffee and tea station available during all the event besides coffee breaks. Now, there's an important announcement I need to do, so please may I have the attention of people with VIP boat party tickets. So the announcement is just for people with VIP boat party tickets. The meeting point will be at the deck at 4. The boat leaves at 4:20 and will not wait, as you can imagine. So it's a little bit different from the auditorium. So you know that thing like 5 minutes and I'll meet them, unless you're a good swimmer, that won't be easy. So it's really important that you use the app. On the app, if you choose the option venues, or in Portuguese, auditórios, you will have all the information there. The boat name is called Gaivota, which is seagull in Portuguese. So the catamaran Gaivota, if you choose venues on the app, you choose catamaran Gaivota, and there you have everything you need to reach the place at 4. And I repeat, the boat leaves at 4:20. It's going to be what a party. Now, let's kick off the second day. TEJ VIRK became the CEO and director of Acanda after his previous role as president of Europe at Chiron Life Sciences. TEJ started his career in investment banking, spending 15 years with BMO Capital Markets, with his final year focusing on the cannabis industry. He transacted over 100 IPOs and earned a reputation for industry-leading innovation. Let's surf the green wave of legalization with TEJ VIRK. A big round of applause, please.
Thank you for the kind introduction. So we're missing the cover slide, and maybe things are a bit out of order, but I'd like to give a little bit of context on what I'm here to talk about, which is catching this green wave in Europe. We're seeing a wave of legalization across Europe happen. It's medical, potential recreational, and from my perspective, I've had a great time here over day one, listening to the experts, the medical community, hearing the R&D perspective. I'm going to present the perspective of the corporations trying to make good in this market, to create a profitable endeavor which benefits multiple stakeholders, the patients, the communities where we operate, and of course our shareholders. Acanda Corporation was a recently founded company. I founded it last year, and we've done a lot in a short amount of time. We've raised over $20 million, went public in the United States on the NASDAQ, and we are an international medical cannabis and wellness platform focused on markets in Africa, Europe, and this whole sort of EMEA corridor. So the only pure play focused on EMEA that's listed to my knowledge. I think in terms of my background, I'm uniquely qualified to talk about these perspectives of catching the green wave given my experience in industry. So I've had 15 years of experience as a banker, lots of focus on equities. I was top ranked for years, raised a lot of money on IPOs, and I left the banking world in 2019 to join the cannabis industry for many personal and professional reasons. But I think that video that we just saw really touched on a few of those things. That there's this giant mean reversion as a society. We're seeing this readoption of cannabis as a medicine, and I wanted to be a part of that. I've had 5 years of experience in the industry, being managing director at Canopy Growth in Frankfurt, leaving Canopy Growth to join Chiron Life Sciences, a medical cannabis company headquartered in Colombia, Setting up these businesses across Europe, I've touched business interests in 5 continents in cannabis. I've worked across a dozen countries in Europe. It's been a very exciting journey, and I'm very happy to now land at Aconda, where I get to be the CEO. I get to execute the best vision of what I think this industry should look like and how I think this company should be run. The landscape is challenging. Now, I know the title is How to Catch the Green Wave, but in a way it's how to catch 27 different green waves. We're talking about the European Union, but different countries, sovereignties, rules, regulations, these are all things that we need to contend with. And that leads to fragmentation. We're seeing fragmentation in the rules, the product offerings, something that people don't talk about, but cultural distance. That's probably one of the biggest challenges in operating a cannabis company across Europe, is really getting people to talk to each other and understand each other, the work cultures. Of course, there's this one point that unites everybody, which is seeing this happen, seeing the industry be successful. But I'll touch that on that when I get into our team slide. There's also a lack of consistency in the product that's available. I think that's something that we've heard over the last day for lots of reasons, right? Regulatory hurdles, a lot of mixed business interests from global companies, but I think that's changing, and we're starting to see that open up, and at Aconda we want to be a part of that solution. It also touches on the limited product type variety, so I think that we're so early stage, you're not seeing too much in the way of variety. Some of that is regulatory, some of it is just time in the market. We're still at very early days, so you don't see all the varieties of products that you would in other markets like North America. Vertical integration is scarce. Again, this is a new market, so it's difficult to find companies that have that full value chain. There's an opportunity to increase social impact, which is something that is, I think, still a bit lacking. I think there's been a race to build this industry globally, but I think maybe leaving some of the stakeholders behind in the communities where we operate, I think there's real opportunity to differentiate there. And I think patients and consumers want to see this as well. And it's proven empirically, people want to be sourcing their products from ethically sourced companies. What makes this challenging is that there's a large adult use market that's imminent. So we're medical now in Europe, largely in the countries where we've seen legalization. But we know there's a big recreational market coming. How do you build a business that is profitable today, but can then hyperscale to that opportunity? So I wanted to give you our perspective. Now, Aconda is doing what we can with our tools, but just a little more context on what we've seen in Europe so far, which will take us into that discussion, is that this is nothing new. We've seen this really go back to the 1970s with Holland actually pushing for some kind of form of legalization, these coffee shops, which we're all familiar with. And when I speak to shareholders in the United States, I think that they usually gets the kind of the smirks and the giggles, but it's really taken off since then. And we've seen really important precedents set. Germany, I think, really being the leader in terms of legalization for medical, and we're really now seeing the potential for recreational open up. That's why I have this next step. Watching very closely what Health Minister Lauterbach will do in Germany. I think that will have real repercussions on the rest of the European Union. How are we addressing these challenges at Aconda? How are we catching the green wave? Well, we're building a company that is able to be vertically integrated. So we talk about this as a seed to patient model. We also talk about it very simply as grow, move, and heal, the 3 pillars to our business. So we grow and manufacture the product. We move it to the markets where they need to be, whether that's an owned or partner channel. And then we're healing people. We're actually getting the product into the hands of patients. And that's still a problem that needs to be solved. We're doing this with our own product, which we call 1P product, but we don't have all the product in the world to solve all of the needs and the consistent quality. So we also work with partners, third-party partners, or 3P product. And so we've created this system which works across Africa, UK, and now most recently Portugal, I'm very proud to say, and that serves this end market, which is really emerging. We're doing this with a firm view on ESG and ethics as well. So we're taking the view of really transferring skills to communities where we're operating in, making that social impact, in investing in people's well-being, and that really, we think, is going to serve us in the long run. Just to hone in on some of our assets, our company was founded with 2 core assets, one being our Bopelo bioscience asset in Lesotho, South Africa. So this is a landlocked country in South Africa, which I think more people know in the cannabis industry, but I think broadly is still getting more profile. It's one of the first countries to legalize cultivation and manufacturing of cannabis in Africa. And we have an outdoor and greenhouse cultivation site licensed up to 500 acres. So quite a large site and potential to produce a lot of product. We also have an import and distribution business, or a wholesaler business in the UK called CanMart. So this has the difficult to attain licenses and maintaining for importing and distributing medical cannabis and other narcotics to pharmacies and getting those in the hands of patients. In April of this year, coincidentally, we announced it on April 20th, 4/20, we acquired Hologen in Portugal, which is really a flagship asset for us and ties everything together. Hologen is a state-of-the-art indoor grow facility in Sintra, just 20 minutes away from here, as well as an outdoor and greenhouse cultivation site in Aljustrel. And that really helps us to bring all of these assets together, serve these markets, and also not just our product, but also bring others and as a platform onto the market. We built a team around this. So I talked a little bit about this cultural dissonance and fragmentation, and so I've tried to build a team of global citizens who have that experience in multiple markets, that have built businesses in multiple markets, especially around cannabis. I talked a bit about myself, again, having touched 5 continents. I've worked in Latin America, now Africa. I've lived in 4 countries. So I'm really taking that experience and applying it to Aconda, which I think is so important given the challenge that we have ahead of us. Luisa Magella, our chairman, is one of Africa's most prominent businesswomen. If you look her up, you'll find that she's been featured in Forbes multiple times. She's very well known for her impact on ethical investing and giving back to communities. She was CNBC Africa Businesswoman of the Year. Really an amazing person to provide that profile, but also the governance. She's been member of a number of the most prestigious boards in South Africa. On our management team, Trevor Scott. I think some people sometimes ask me where the Portuguese management is on the team. So Trevor, very interestingly, our CFO, is half Portuguese, half Scottish, and raised in South Africa. So kind of the perfect CFO for our company. So and his family actually comes from the Sintra region. So it's been really great integrating him and building this company together. Dr. Aslia Karschenkel, based in Munich, really our quality assurance expert, has built multiple cannabis companies herself in Germany and helping us to bridge this gap. And we're really seeing this happen. I mean, bringing the knowledge of the end markets and the standards to Portugal, to Africa, is really going to help us accelerate our path to market. Dr. Sunny Nahi, a leading prescriber in medical cannabis in the UK, and then our team is rounded off on commercial with Greg Beadle and Vijay Ayer. The board we built around the company also to tackle these challenges and ride this wave, world class. I hope you can tell from the slide, but majority female, majority racially diverse, majority independent. These are all standouts when it comes to the industry. They're standouts when it comes to the NASDAQ, where we're listed. And so it gives us the diversity and different perspectives, which we think will make us very successful. And just to touch on a few, Bridget Baker, she was a founder of CNBC, was on the board of directors of Yahoo. We're getting that profile and that perspective. To hone in on Portugal, how we think this is going to help us ride the green wave. So Portugal, I'll give some perspective. I think in having been here for the last a day or so and meeting with the local community, which I feel very embraced by. I'm really, really happy to be a part of this. I think that we can have a tendency to be self-critical and look where the problems are. Where can we improve? But as an outsider looking in, for now, I can say that Portugal is really positioned to be a center of excellence for cannabis across Europe. The infrastructure, the investment, the responsive regulator, the talent pool, all the right ingredients are here. And the fact that we've already seen this start to work, we've seen the export market start to develop. Now, I want to really see this domestic market come together, but that's a first stage proof of concept. You can create the product, you can get it to patients that are in need, and that's happening. And so we want to build on this. We can see that I'm not the only one that has this opinion. Prohibition Partners shares in this. And I think there's only growth to come from here. And this is a place where I want to be investing in terms of building that capacity and building that expertise. So really press that advantage, I think, is going to be important. And what's great about it is that if I tie it back to the vertical integration, we can use this for our own product, but we can also create a platform for bringing in product internationally. So Portugal really can be a hub for the European Union. What are we doing on the ground specifically? So it's early days. I think I've now had a month and a half to have reins over the operation, and we're forming our strategy in terms of what to do on the ground. But I think some of these things are pretty obvious. It's engaging with local partners, being at conferences like this, starting to know who's who, and really fostering an ecosystem. I'm of the firm belief, while we are a company focused on creating a profitable endeavor, but we're so early stage. We're all such small companies. This co-opetition model probably makes more sense, and it's really about growing the asset base, growing the size of the pie for all companies to prosper, and really, again, making this happen, getting product into the hands of patients and what will soon be consumers. Lobbying is important. I don't have the budget that I once had working at a multinational to do the proper lobbying efforts, so I try to focus these efforts on the real decision makers. It was great to have some time with Vasco from Infomed yesterday. I spend my time doing this in the UK and where possible in other countries. South Africa had numerous consultations with government and regulators. So that's important because they need to hear that two-way perspective. What are you seeing as an operator? Where are the challenges? And if you don't have that dialogue, it's very difficult to be successful. Meeting with the medical community and patients, that's what it's all about. If you're not out there actually meeting with people on the front line, the patients who are in need, you won't have any perspective. And so that's very important, and I try to do it personally as much as I can, but that's also where people like Dr. Sunny come in and our B2C partners who work at the clinics. We listen very carefully to this. When we also pay attention to trends in other markets, so Canada, the United States, these are somewhat leading indicators for what we expect to happen in Europe. And then scaling the business, just going back to what I said earlier, Portugal and Hologen in particular has a real potential to be a hub. We're very excited about it. Our complete focus is on execution and making this happen, and I think this is something where you really should watch this space. To address the point of products, so I mentioned something about lack of quality, lack of variety. Again, we're early days. And so we see largely in Europe a market dominated by dried flower for inhalation and extracts. This is going to change. Now, we can always get into the nuances of what kind of product you can register in what market and what's a finished product and what's not. And it's going to be a circuitous path, but we will eventually see products like vape pens. We will see other types of edible products or ingestible products, orals, capsules. It's all coming. And different markets will have them sooner. I'm very optimistic on seeing more product variety in Portugal than I am in Germany, at least in the very short term. So there's plenty to do. In terms of our approach, we're working with trusted brands so far from other global markets. You'll probably recognize a few logos up there. We're either distributing these brands, licensing their IP, and really trying to bring them to market as fast as possible. In terms of our in-house, we now have over 40 strains which are very successful in the adult use market in Canada. Now I think there's a crossover in terms of their medical efficacy, but we're also preparing for what will be a recreational market. DNA genetics, and really there's a list of others that would like to be a part of this. So it's something definitely to pay attention to. And why do you care about brands? Well, brands usually are trusted because they have a couple of things, the quality and the IP, and that's what we really care about. A few snaps of our operation in Portugal. One of the things I really want to do is to get a camera crew in and take some better photographs, but this is what we have for now. And this indoor facility in Sintra, from my perspective, it's a one of a kind in Europe. You have 20,000 square feet of indoor premium cultivation, really the pinnacle of industry R&D, because I know who built the facility. I know where they learned from. This is benefiting from the billions of dollars that were invested in indoor grows from places like Canada and the United States. And it's operating right now in Portugal. It's producing saleable product right now. And so we're proud of that, and we want to build on top of that. It also gives us the capacity to work with partners to create a platform to bring their products to market. So again, this 1P, 3P, all pharmaceutical, all working hand in hand with the regulator, and we have an amazing team on the ground which is implementing this. We have an outdoor and greenhouse cultivation site in Sintra, in Aldershell, sorry, and so just 2.5 hours south. This is going to give us further optionality. We're going to tailor this around the market need and the market demand, and so we're able to address the market today with the Sintra facility, but we can hyperscale with Aldershell. This is where we're going to be able to produce a lot of product that's either going to go into extracts, into different types of value products, and so we're going to bide our time in terms of that. You could say the same with our African project. So we have this ability to be profitable today and scale to the future. To say a word on social impact. So again, something that I think has been left behind in the industry, and what I'm proud to say we're addressing at Aconda is really focusing on transferring skills and investing in the communities where we operate. Now, I think the social impact can be most apparent in Africa. I do want to start thinking about what we can do in Portugal as well. But to give a few examples of what we've done, so as a company, we're now hitting 12 of the 17 UN Sustainable Development Goals, which I think is something to be really proud about. There's 5 that we're not hitting, but those tend to be more government-led initiatives. But the fact that we can have an impact on providing clean water, food, ending poverty in some cases, it's quite astounding and something to really be gratified about when I see it on the ground. We have affiliations with 2 trusts. One is the Maputhi Matsusu Development Trust, and I actually took that photo myself at one of the schools that we donate to. And so this is about really building on the future. Where we operate in Lesotho was really a place where there was a lot of subsistence farming, and now there is mass scale horticulture. There's upwards mobility, and it's having a real impact on the economy. We pay nearly 3 times the average wage, and that ties into the other trust that we founded. So we have another trust called the Aconda Bokomoso Empowerment Trust, where we've actually put 3% of our company's equity into that trust for the benefit of the communities where we operate. And that's going to include Portugal as well. So this is something that is differentiated. I'm hard-pressed to think of other companies in the space that have put that much of an investment into the future of the communities where they work. So with that, happy to open it up to Q&A, my favorite part of these talks. Aconda, as a B2B company, vertically integrated, we're doing our best, but happy to talk about more perspectives.
Time for an applause. Thank you, TEJ VIRK.
Thank you.
So questions and answers are open, so please raise your hand in case there you have, in the back. Yeah, on the right. We ask you to raise your hand, otherwise we don't even know who's asking the question. Please be brief, let me remind you. And don't get me wrong if I have to say stop, but go ahead.
Hello there, hi. Thank you very much for coming, thank you for your talk, I appreciate it. Just a question about your facility in Sintra, if you can share who designed and built it, and why do you not use LEDs? I saw HPS in the photo, if you're thinking about moving to LED technology to save on power, sustainability, etc. Thank you.
Yes, I think I heard the question was who designed and built the facility?
Who designed and built the facility, which company, or if you can share, please, and why are you showing HPS and no LEDs? Thanks.
Yeah, so I can touch on a few things. So really, we bought the company from another Canadian company, which is listed called Flower Corporation. So Flower is known for creating very high quality dried flower for inhalation, and so they put a lot of the work into the design and the heavy lifting. So so I'll put that question there. In terms of R&D and where we're going with it, these are things that we're looking at. Some of this is really dependent on budget and funding that we can get, but our first focus and priority is to get product into the market. As soon as we have a little more of an operating budget, these are things that I am interested in. I want to see what we can do in terms of opening up testing. That's a big one. So being able to really start drawing links between the products that we're putting on the market and the cannabinoid content. These are places that or an area of focus that I like. Different form factors would also be of interest, but again, these things are budget dependent.
Thank you. Another question? Yes, over there.
Hi, thanks for the talk. I was just wondering, as a kind of CEO, and to the extent that you can share, what role does genomics play in your global operations, and your personal perspective on the importance or that this may have as a technology for the future of cannabis production? Thank you.
Yeah, it's a great question. Very, very open-ended. So genomics, strains. I mean, this really, it's in a way that's the cornerstone of the business. And I'm very happy that in the acquisition that we did, we picked up a library of over 40 strains, which are tried, tested, and true in places like Canada. We're seeing really amazing results of some of these strains in Portugal. And why does it matter? At the end of the day, you are growing. Thank you. At the end of the day, you are growing a plant. And there's different conditions and climates, and if you're growing outdoor or a greenhouse, you need to have some evidence that these have worked. You need to have potentially strains that are resistant to the different issues like powdery mildew or maybe resistant to some kind of parasites or insects. So strains do matter. It also matters in cannabinoid expression, cannabinoid profiles. So this is something that we care very much about. We have this library. Do we want to build on it? Absolutely, and that's why we're focusing on licensing different IP and brands. So if we can't do it in-house, we'll work with external partners. And the good news is there are a number of partners that would like to work with us, so we can benefit from their millions and millions of investments.
Thank you. Any other questions? Someone? Let me see the ends. No? We're done? So, oh, there's another question. It's always like this. When I'm about to ask for an applause, there we have another question.
Keep going with the Q&A. Thanks, Tej, for the talk. I know you said you spent some time with both Chiron and Canopy. What was your biggest takeaway from that time spent in the industry with those two large players?
Yeah, it's a great question. Number one would be have the decision makers for the business in the markets where you're operating in. Number one. It's very difficult, from my perspective, to run a business in Europe if it's headquartered on the western coast of North America, right, or in Toronto, or in Los Angeles. Like you don't have that same perspective, and I hate to say it, but sometimes that North American mentality, Europe is a city, and you don't see these nuances. You're not in the market. So I think being in the market is the most important thing, and then really the second is keeping it lean. Keeping a tight hierarchy, being able to talk to everyone in the company. I mean, you don't need it to be too big right now. Focus on building a sustainable business and then scaling.
Thank you. So now I guess it's time for a round of applause. Thank you, TEJ VIRK. Thank you.
Cheers.
Now, we're going to the next presentation, but meanwhile, after the next presentation, we will have a coffee break. So let me ask those of you with VIP party boat tickets not to leave immediately, because we have an announcement in case you didn't listen to it early in the morning. And so after the next presentation and Q&A, please stay for a little bit so that you can get all the instructions and be there. Now, ALFREDO PASCUAL. Based in Germany, Alfredo Pascual has an academic background in business and public policy and is currently Vice President of Investment Analysis of Seed Innovations Limited, having worked as international analyst at Marijuana Business Daily, where it focused on covering how cannabis markets and investments were evolving internationally. Now, I'm checking if it has his mic on, and it does. So from Uruguay, living in Germany, please welcome Alfredo Pascual.
Thank you. All right, is this ready? Yeah, so, oops. So you might be wondering what an investment analyst is doing speaking about the single convention and all this weird international law stuff. And that would be a good question. The reason is that before I even started working in the cannabis industry, I did a master's degree on public policy in Germany, and I focused on drug policy reform in particular. I've been attending these mysterious meetings in Vienna quite a few times, even before there was a cannabis industry or a so-called cannabis industry in Europe. And this is a topic that has always fascinated me. And of course, I need to say that I am not a lawyer, and I'm not here to say what is legal or not legal when it comes to international law and the possibility of legalizing adult use cannabis. For the most part, what I will be doing is to try to summarize what I see as potential challenges from countries that might oppose Germany or Portugal or other countries legalizing adult use cannabis. Before I start the key part of the presentation, I also think it is important to emphasize how important international law is in general, and also when it comes to the infamous in the cannabis industry single convention. We tend to think that that is simply about cannabis prohibition, but it's not just that, or it's actually quite a different thing. It's an instrument that allows the orderly trade of controlled medicines internationally. And I often hear in the sector, well, we just ignore it. It's old stuff. Nobody cares about that anymore. But I think it's more complicated than that. And we should be careful when we say we should just simply ignore international law, because it still is key to prevent conflicts. And I know everyone will be thinking now about Russia. But that being said, we tend to focus on when international law fails and not when it works. And most of the time it still works. And we don't want a world where every country is doing its own thing and simply not caring about rules of international, in the case of the single convention, trade of medicines. So I'm going to go through a couple of slides here explaining the example of Uruguay, which legalized cannabis in December 2013, so quite a long time ago. And I think it did so in a very elegant way, at least for what was the situation back then. And I put this here in all caps on purpose, because again, I hear all the time, oh, Uruguay simply disregarded the single convention and other instruments of international law, and nothing happened. So if Uruguay did it, anyone else can do it as well. And let's just ignore the international treaties just like Uruguay did. Well, that's not true. Uruguay did not simply ignore the international treaties. Actually, back then in 2012-13, there was a lot of diplomatic work from Uruguayan authorities in Vienna trying to explain the Uruguayan position of why Uruguay was doing what it was doing. And I think it did so in a pretty good way, and I'm going to try to explain how it was done. But before doing that, we need to understand how usually international law is to be interpreted. This is quite complicated to explain in a single slide, but in a nutshell, there's this article of the Vienna Convention on the Law of Treaties, which is a treaty about treaties, basically, a treaty about international treaties, which explains how international treaties are to be interpreted. And the way that it should be done, it's like a circle of these three things. One is a textual interpretation of the treaty, meaning what the words mean simply without any context, without anything else. Another one is the context interpretations, meaning what the drafters of the treaty intended when they were doing so. And the third one, which is the key here, is that it needs to be interpreted in light of its object and purpose. So when we do this with the single convention, this treaty that is often mentioned in the sector that restricts in the case of cannabis, it's used for medical and scientific purposes. If we do a textual interpretation, it looks pretty bad, that we will not have much of a chance legalizing cannabis for adult use purposes and justifying that with the text of the single convention. If we look at the context, there's the commentary on the single convention, which is a very long text, basically providing all the context of how it was drafted. And again, it looks pretty bad. But if we look at the object and purpose, things start to look better. And what Uruguay did was to say, we are still fully committed to international law, and in particular the single convention and other instruments of international law that regulate narcotics. But what we are seeing is that the way that the single convention has been implemented these past few decades simply has not worked to achieve its purpose. And what's the purpose of the single convention? Just read the very first pages, and when you go to the preamble, it starts with the parties concerned with the health and welfare of mankind. So I think Uruguay had a brilliant argument back then, saying that this prohibition simply has not worked to advance the health and welfare of mankind. We need to do something different, and that's what we are gonna do. We are gonna maybe, they didn't say it like that, but it could be said that Uruguay stretched the interpretation of the treaty to fulfill its objective. And I think that was brilliant, back then at least. And how did Uruguay justify this is also interesting, because it was not simply we will legalize and see what happens, it is we will do it quite in alignment with many things that are written in the convention. So there were two key pillars in the legalization in Uruguay. One was harm reduction, understood both as health and safety. So this is key because that's what the single convention is about, at least the health part. So what Uruguay said is basically users having access to substance in the illicit market are not being protected in terms of health or safety. So we want to legalize to start protecting them. And then state control, which again was key. Uruguay never intended to create an industry, at least back in 2012-13. The objective was not commercial, it was to protect the health and safety of citizens, and for that, the argument is we will have a lot of state control. Maybe seen 20 years later, almost 20 years later, it looks like too much. I agree with that, but back then, it was basically all what Uruguay could do to avoid annoying neighboring countries, for example, and that's the reason why cannabis tourism was not allowed in the Uruguayan legalization. So again, that was in a nutshell the argument of Uruguay: harm reduction and state control. The law follows the spirit of the convention. Just look at the preamble. This is what we are gonna do. And there were a couple of other arguments in the case of Uruguay, which was one, the primacy of human rights, again connected with the health issue. Uruguay said we have a bunch of international obligations. It's not just about the single convention and other drug treaties. Yes, controlling drugs is part of international law, but there's more than that in international law. And there's the famous primacy of human rights. And if humans have the right to health, we need to prioritize that rather than controlling drugs. So we will first prioritize the health of our citizens, then we will continue controlling drugs. And then there's the primacy of the Constitution. Again, this was another argument that Uruguay used back then, and what you can read there are it's the actual text of the 1961 convention in the case of the first one, and the other one is the 1988 convention, I think, which in several parts it says that this convention basically applies, but subject to the constitution of the countries signatories to the convention. And in the case of Uruguay, again, Uruguay used the constitutional argument that that had priority. So that's how Uruguay did it. I'm not saying that's how every country should do it. It's simply an example of how it was done to legalize adult use cannabis. In the case of Uruguay, arguing that it was compliant with international law. Uruguay never acknowledged a violation, but there are other options that may work as well. And I'm gonna quickly go through the different types of options. So not necessarily one is better than the other, these are simply different options. So the first one is rescheduling or also descheduling cannabis, because this again, speaking only about the single convention now, you have the text of the single convention and then you have schedules to it where different substances are included. Just think about it like attachments and annexes. And we probably all heard about what happened in December 2020 when the Commission on Narcotic Drugs, basically the countries signatories of the convention, decided to remove cannabis from Schedule 4 of the 1961 convention. That was a historic, symbolic move, because with that they were implicitly acknowledging the medical use of cannabis, but cannabis still remained in Schedule 1, and the way that the schedules work is a little bit weird, but Schedule 1 in a nutshell still means the highest level of control. And to do that, it was very complicated. It took years of diplomatic efforts. It took a WHO report on cannabis as well. And at the end of the day, it could be done, but the vote was won by simple majority, but just by 2 votes. So it was 27 to 25 with 1 abstention, I think. So it was quite complicated. And here we're talking about a cosmetic change of cannabis for medical use. So with this, what I mean is there's little to no chance that we will see, probably in the near future at least, cannabis being completely descheduled from the convention, removed from the convention, because it's just not realistic. Another option is an amendment, which again could be done. It's in the text of the single convention that is possible, but it's complicated. In legal terms, it's not that difficult. If a country wants to amend the convention, they simply can present a proposal, and then they can even force a vote on that. But in practical terms, it's much more complicated than that, because, well, first you would need to convince half of the world to agree on removing cannabis from the single convention, or amending the convention for it not to control cannabis. And secondly, the problem with cannabis is that it's not about the single convention only. It's 3 different instruments of international law that regulate cannabis in different ways, and all 3 would need to be modified, and that's mission impossible. It's really complicated because each of these treaties has different procedures for their modification. So again, in legal terms, it's possible. In practical terms, more complicated. And then another option is withdrawing from the convention. We don't like it, so we quit, basically. Again, in legal terms, that's super easy. A country simply needs to send a letter, and then with that, depending on what time of the year that is done, 6 months or 1 year later, the country is not bounded by those obligations anymore. In legal terms, that's easy, but it's quite risky in political, economical, and reputational ways. There's no precedent of a country simply denouncing the convention without re-entering it, and I really doubt that any European country would do that anytime soon. And then there's the very famous example of Bolivia that is being mentioned a lot these days, which denounced the convention, but then re-entered it with a reservation regarding coca leaves. Again, this is, in legal terms, quite easy to do. In practical terms, things are usually more complicated, and the reason is that for that to work, then fewer than 1/3 of the countries signatories to the convention, which are basically all of the countries in the world, need to not oppose that. So if more than 1/3 of the countries oppose that move, then re-entering the convention would not be possible. So it's a risky move. Imagine if a country would simply denounce the convention with the hope to then re-enter with a reservation, and then it happens that more than 1/3 of the countries oppose that move. That would mean that country, in theory or in practice even, would remain outside the convention, and that would make a lot of things really complicated when it comes to the international trade of controlled medicines. So it's possible, it's complicated. And the other thing is, how would Germany justify it? So when Bolivia did it, it did so based on indigenous traditions that were ancient in Bolivia when it comes to the use of coca leaves, not cocaine. And Germany would, or Portugal would need to come up with a very good argument. It is not simply that I mean, in legal terms, it's the same. Germany or Portugal could say, we want to do it simply because we want to do it. It doesn't need to be justified on traditional use, but a justification like the one of Bolivia, let's say, it helps make a good argument to convince other countries not to oppose that move. And one more thing about this, if Germany were to move with something like this, previously, I'm of the very strong opinion that the German government should apologize to Bolivia and correct an historical mistake, because Germany was one of the very few countries that opposed Bolivia doing this. I think it was like probably less than a dozen countries that opposed Bolivia doing this, so it was not enough to get to the 1/3 that would have been needed to block Bolivia from doing this, and Germany was one of the very few countries that opposed that move. So I think Germany, before talking about legalizing and doing this to solve this international issue, should apologize to Bolivia. By the way, there's the president of Mexico that again opposed Bolivia doing that, but then they withdrew that opposition, a symbolic move, but still important. And then there's the inter se option, which is I'm starting to hearing it all the time now. I think it will be used more and more in the following months, this option in terms of the debate. And I'm afraid it's starting to be used in the cannabis industry, like the GMP term was used a couple of years ago, that it was thrown around all the time, GMP. Now I think we're gonna start hearing inter se all of the time. In my role as, in my daily job as an investor, I am already receiving proposals for investing opportunities of companies that plan to export to Germany for recreational purposes before there's even a bill. And whenever I ask how you're planning to do it, I are already getting the inter se word or term thrown around. So is that possible? Yes, it is possible, but again, it's a little bit complicated. How it could work is that it would be some sort of group of countries, like-minded countries, think Germany, Portugal, maybe Malta, Luxembourg, Netherlands, that among themselves would establish specific rules that would apply only among themselves, and they would keep their obligations when it comes to the single convention and other instruments of international law. And this is also regulated by the Vienna law that I mentioned that regulates other treaties in Article 41, but it's uncharted territory. In terms of it has not been done for cases like this before. And there are a few issues with that. First is that the treaty that I mentioned that regulates other treaties is entered into force in 1980, and its Article 4 specifically says that it does not apply retroactively, and the single convention is from 61, it was then modified in 71, but in any case it's previous to 1980. There's a counter argument to that, and it is that what that treaty did was simply to codify what was already customary international law, so they didn't reinvent the wheel with the inter se option. It was something that already existed. This was simply codified in the treaty, so that would mean that it would indeed apply retroactively because it was something that existed already, but that's debatable at least. And there are a couple of other issues with that, including that for an inter se option to be valid, then the countries that would be doing that would need to make sure that they would not affect other countries in their obligations to the single convention and other instruments of drug control. And that's, again, easier said than done, because if Germany or Portugal legalize cannabis, and then you have a bunch of cannabis tourism going to, for example, Germany, it could be the case that other European countries would say, hey, you are making our life more complicated in terms of drug control, and that could be an argument against an inter se modification. And then to finish, because I'm getting some signals already, we have EU law, which is another Pandora box, basically. There's not a lot new when it comes to EU law. It's basically about the implementation on a European Union level of those international treaties. Again, they're not reinventing the wheel with these things. And there are three things that could be an issue. The first one is a little more complicated to read. I did that on purpose because that has been repealed in 2006. But it's still important to consider it, because when it was repealed in 2006, it was done because it was considered to be obsolete because of this other framework decision, which is the key part of EU law that regulates these things. And this framework decision, again, it's a little bit complicated because it basically does not allow to legalize commercial cannabis production for non-medical purposes. And it has a key word there, which is without right. So countries, in a nutshell, will not be able to legalize cannabis for recreational purposes without right. So the key is what without right means. if we go to the Green Party bill that in Germany that was presented a couple of years ago, they acknowledged this issue and they said, well, without right, we're going to legalize, so then it's going to be legal. This doesn't apply to us anymore. Of course, they didn't say it with those terms, but if you read the bill, that's the impression that it gives you, that they are thinking. And I mean, I think that's wishful thinking, because when this was drafted in 2004, the idea was to harmonize law in Europe in terms of drug control. It was not to keep the door open for countries to then do whatever they want and simply say, because it's legal here, then this doesn't apply anymore. But I recommend each one of you to actually read this article and get your own conclusions there. And what's interesting about the framework decision is Article 2, the second part, which very explicitly indeed allows legalizing for personal consumption, so growing at home. And this is certainly okay. There's also the Schengen acquis, which is another level of problem. And again, this is issue, right? It's about illicit traffic. You should read articles 71 to 75 approximately. And if you see there, it's always about the illicit trafficking or illicit whatever with cannabis. And there's always the argument, well, if we make it legal, then it's not illicit. It doesn't apply to us anymore. I think it's a matter of international diplomacy more than interpreting the law. So what's for sure doable without many issues? Decriminalization, that's certainly possible within international law. There's no doubt about it. It has been done in Portugal and other countries as well to different extents. It's also possible to legalize cultivation for personal use. Again, this has been done in different countries, including in the European Union. No big issues there. And then I think it's also interesting to think about scientific experiments, because when you read the Single Convention and other instruments of international law regulating narcotics, they always talk about medical and scientific uses, but that is not defined. So what is medical? We had that debate yesterday. And what is scientific? That is not defined. So let's say that a very open medical program arguably could be okay, and scientific experiments as well, because does scientific means only clinical trials, or does scientific also include social issues? If it includes social issues, then that's also justifiable. So I do like the Switzerland approach. So these things are definitely possible. They have happened already. More than that, we'll have to see. Thank you.
Thank you. Thank you. Quick correction. We still have Stephen George. My mistake. I'm sorry, Stephen. So it's not coffee break yet. Now, questions and answers are open. Would you please raise your hand if you have a question? Shy audience. There you are.
Thank you for the presentation. Yeah, it was very open-minded. But I have a question, which is, I think I know the answer already, but even if one country abandoned or somehow decided to leave the convention, it still not apply, let's say Bolivia. If Bolivia or Uruguay wants to export to Germany, they still have to comply with the German law.
Can you paraphrase the question, repeat the question in different
So
words?
even if one country decided to withdraw from the convention, if they want to export to another country, they still have to follow the rules of the destination country.
So if a country were to denounce the convention, then the obligations do not apply to that country anymore. At least that's, if you read it in legal terms, the convention wouldn't apply anymore. That country would be free to do whatever it wants. Then, so you could then make the case, what if two countries withdraw from the convention? Then the obligations do not apply to these two countries anymore. Yeah, in legal terms, that would work. In practical terms, that's always more complicated because of the risks involved there. And there's another thing that is quite important, and it's connected with EU law as well, and it is that these conventions, in particular the Single Convention, are not like isolated from other instruments of international law or treaties among countries for commercial purposes or other things. So many times there are like commercial agreements, for example, between countries that have as a requisite that these countries comply with the Single Convention, for example. Don't forget that now this is very old, it's maybe not fit for purpose anymore, it's outdated, but 20 years ago this was still pretty much consensus internationally. So, I mean, in legal terms, what you are proposing, yeah, countries withdraw from the convention, then start trading among each other. That is possible. In practical terms, that would be more complicated because of the political risks of doing that, and also because there are other things connected with the single convention.
Thank you. Another question right over there.
Based on the risks around legalization with all the different countries, as
Could
an
you
investor-
please speak a little bit louder?
Sure.
Sorry.
Based on all of the risks around the legality of this in all the different countries, how are you navigating the investment side of things? Like, how do you decide which countries to invest in, which products, all of those other pieces?
Great question, I like it. So as an investor, I need to consider different scenarios. I try to be optimistic, but I also need to consider what could go wrong. And yeah, sometimes things go wrong or things take longer than we would expect. And for me, that means that investing in a company with a business plan that is contingent upon regulatory change that still has not happened is very risky. So yeah, it would need to be considered as an extremely risky scenario. And we should also consider precedents of other countries that were about to legalize adult use and then for one reason or another didn't end up doing that. And there are quite a few of those. We have the example in the European Union of Luxembourg that with the coalition that came into power in 2018, they had it in its agreement to fully legalize cannabis, including for commercial purposes. Then they basically decided to this year legalize growing at home for personal use only. It could be that part of the explanation of that is EU law, or simply that they are waiting for Germany to go first to avoid any trouble, and if Germany does it, then Luxembourg will do it as well. But there are other examples as well. We have the example of Israel that basically 2 years ago had a government which again had the consensus and the intention to legalize adult use. They even promised a timeline of 12 months. Then what happened? The government fell, so they couldn't do it. Now the actual government in Israel doesn't seem like it will do it. We have the example of Mexico, that if you start reading headlines of the last few years in Mexico, it seems like it legalized adult use a bunch of times. It's still not legal there. It's complicated. You have the Supreme Court decisions, but the parliament hasn't done it, so you don't have a regulated market. And with this, where I'm going is that it's risky to expect adult use legalization for your business plan. So as an investor, if the business plan only makes sense if adult use is legalized, I would tend to look at it very carefully. If the business plan makes sense without adult use, then adult use would be a plus, nice to have, but it would need to make sense without that.
Thank you. There's another one in the back. I think it's the final one.
No.
No. Oh, sorry. So we have
Hi,
two more and
Alfredo.
we have to close.
Thank you for an elucidative presentation, as always. I wanted to ask you for a brief question to a recent paper that was published by Kenzie Ribble at Zemoli, that basically states that the conventions are in a way just guidance or framework guidelines to regulate either medical and non-medical applications. And from his paper, he explains that non-medical parts non-medical legislation can be done if follows that two requirements, that is implement effective measures to avoid harms and provide reliable statistics to INCB. What's your opinion on this work in particular? I think you know it.
Yeah, I know it. Thank you for your question. I would need another half an hour to discuss that paper.
You don't have it.
So first of all, I do know Kenzie very well. I would even consider him an industry friend, and I've been seeing him at every meeting that I went to in Vienna. So he has been more involved probably than anyone else in this room and in the cannabis industry when it comes to these things. But I disagree with that paper largely. I think it's a purely textual interpretation of, in particular, one article of the Single Convention, Article 2, Paragraph 9, if I remember correctly. And that article was I think it's quite clear that it was intended for industrial purposes. It was not intended for adult use legalization. And I say it's in my opinion, it's a selective interpretation of that article, ignoring other articles, because you have many other parts of the convention that are very clear in terms of the limits of medical and scientific purposes. You have Article 4, which is a general obligation, and it's very clear there that countries should limit that to medical and scientific purposes. And the other thing is that, I mean, Kenzie might be right. Let's say Kenzie is right in his textual interpretation of Article 2.9, I think it is. That would mean that during the past 50 years, everyone else has been wrong, right? And it's going to be a tough battle to tell everyone that they have all been wrong, because Kenzie just found this textual interpretation of that article that allows adult use. I think, I mean, again, I always say that there's a difference between textual interpretation and what in legal terms things might mean and what could happen in practice. So even if let's give Kenzie credit and he's right about his textual interpretation, I don't think it is, but again, it would be a long discussion. The other thing is, does it matter? Like, would countries care about that? And I pretty much doubt it, that any country would go to Vienna to say, hey, I have Kenzie's interpretation here, look, it's possible. Not gonna happen.
Thank you. Last question?
Hi, thanks for your perspective, Alfredo. I'm a globalist, and but I think the UN is an institution of haves and have-nots. What does UN enforcement of the single convention on narcotics look like?
Almost nothing. So you have the example of Uruguay and Canada. You will receive some, I mean, if countries legalize for adult use and they don't do crazy stuff, like shipping to other countries, for example, at most they would receive some love letters from the INCB, which is the organism in charge of enforcing the conventions, if you want, and it would be about dialogue. So if you see that is explained in the single convention, so how enforcement works. And the first steps are a few steps about dialogue with the countries, right? So it's about dialogue at the beginning. In very, very, very extreme cases, it could be that international trade of medicines to these countries is somehow restricted. However, that would need other countries to actually want to do it. It's not simply about the INCB wanting to restrict the trades of medicines. And in 2022, 2023, I really doubt that any country would be blocked from essential medicines simply because that country is legalizing cannabis. So again, in terms of enforcement directly from the UN, in the case of the INCB, it is almost nothing, I would say, but the risk is always reputational. It's always diplomatic, right? So if you have countries saying, hey, what Russia is doing is illegal, and Russia's argument of self-defense is bullshit, then Russia could say, hey, what you're doing is also illegal, right? So it's always about that balance of diplomacy and politics more than about the real enforcement from the UN agency when it comes to the single convention.
Thank you so much. An applause to Alfredo Pascual. Thank you. Yeah, we move forward. And yes, we still have Stephen George, and only after we will have the coffee break. Stephen Arthur George is originally from Michigan, where he received his bachelor's in finance and general business. His professional career started in Nashville, Tennessee, where he spent over 5 years in the finance industry, focused on business development. In 2017, Stephen moved to Portugal to get his MBA and has been working in the European cannabis industry since 2018. He spent over 3 years in Tilray as both country manager and European alliance manager. In late 2021, he chose to part ways with Tilray and started offering independent cannabis advisory services. So, ladies and gentlemen, let's welcome Stephen George from SAC Consulting.
Minor technical issue there, sorry about that. Good morning, everyone. Bom dia a todos. Bom dia, bom dia. Thank you, thank you, thank you. That's going to be the only Portuguese for today, though, okay? The rest of this is going to be in English. But my name is Stephen George. We're going to be talking today about North America versus Europe. Same plant, different regulations. First off, I want to tell you a little bit about my cannabis journey. So I am from Lansing, Michigan. This is unique because Michigan was one of the first states or one of the earlier states to approve medical cannabis back in 2008. So in 2009, I received my medical cannabis card. I was able to grow 12 plants at home. In 2010 and 2011, I grew 4 plants in my 1-bedroom of my apartment, where I started to get a little bit more interested in cannabis in general, as well as the medical purposes. And in 2017, I moved to Portugal. Uniquely, what many people mistake, I did not move here for the cannabis industry. The cannabis industry followed me here. That is what I believe. But I did get here in 2017 where I did the Lisbon MBA. Many of you are familiar with that, and we'll talk about that a little bit more. So, why listen to me? First off, I said I did the Lisbon MBA in 2017, and I graduated from that at the end of the year of 2017. In that class, though, I had one Portuguese physician. There was only 40 students, one Portuguese physician, one Portuguese pharmacist, and one brand manager for a large pharmaceutical company. These 3 individuals helped me a lot understanding the pharmaceutical network in Europe, as more specifically also in Portugal, and were a big help in me into getting my position with Tilray, which you see next. So I spent 3.5 years with Tilray as both country manager as well as the European Alliance manager. The dried flower THC 18 that was talked about yesterday a lot, that was the team that I led to get that product approved into the market. I wish there was more today, but at least there's one. So that was my time at Tilray. Also worked with a lot of different partners across Europe in the B2B market, Germany, Malta, Spain, and also our friends in Israel. Last year in July, I left Tilray and then went on to start my own advising company. That's what I've been doing for the last year, advising different companies here in Portugal, also internationally, mostly on commercial strategy. It's one of the big things that I found. Everyone keep this in mind if you're thinking of starting a project or you're thinking of cultivating or manufacturing or whatever it is, you need to have a strong commercial strategy before you start. You cannot just grow cannabis. It does not just sell itself. That is a huge mistake. Today I'm going to talk about adult use cannabis more, but before that, I want to tell you that I am medical first. As you can see here, this is a childhood friend of mine. This part might be a little bit tough, but as you can see, he just passed away last Wednesday, unfortunately from an overdose of heroin. This is a huge problem in the US, and the point is that he didn't start with heroin. He started with prescription medicine, okay? And it was opioids, which then led to heroin, which then led to 33-year-old Sean no longer with us. His funeral was just on Wednesday. So medical first, okay? This is the point. Patients need access. Everyone should be able to have access to medical cannabis. Like I said, I'm going to talk about adult use. I believe it has its wellness properties as well, but it's medical first, and that's why we need to keep things moving here in Portugal, and that's why everyone needs to work together and collaborate, like Tej said, so that we can move this market forward and meet the patient demand. The agenda for today, I'm going to talk about a little bit difference between the medical and adult use cannabis. We're going to do an overview of the United States adult use market, and then a little bit of what I expect to see in Germany, carrying off what we kind of heard yesterday afternoon. I'm going to have a key takeaway from every section. First one, terrible use of words. It should be cannabis for medicinal purposes and cannabis for adult use purposes. It's not medicinal cannabis or adult use cannabis, okay? It's the purpose that matters. Why? Because it's all cannabis. There's nothing different about medical cannabis than there is about adult use cannabis. Form factors can look different, regulations can look different, specifications can look different, but it all comes from the same plant in the end. But when we dive into regulations, you see a lot of different things, right? In the EU market, you get a prescription per unit, products are dispensed in the pharmacy, and it's regulated by a national health regulator. In the US, you get a card or a recommendation from the doctor, you pick up products in retail dispensaries, and it's regulated by the individual state regulator, not the FDA, which we all know, the Federal Drug Administration, that deals with all the other medicines in the US, okay? And finally, when we look into a little bit of cannabis adult use in the US, Consumers above a certain age have access. It's 21 usually. Products are distributed in retail dispensaries, and it's regulated by the individual state regulators. Now let's break down the medical markets. I think this is a huge opportunity for Europe, okay? Is because, and when I break them down and look at the US market and Europe market differently, the US market did a great job of providing short-term patient access, okay? After regulations were implemented, very quickly could individuals get cards, dispensaries open quite quickly, and patients could access products and different medicines, cannabis medicines, right? So that was great for short-term access. But if you look at the actual regulations with the one card, it doesn't involve the healthcare community much at all, okay? Besides getting that initial recommendation from the doctor. Other than that, you just have to renew with the state every year. So it's not really a great medical program, right? Where I think Europe is doing a great job of long-term access for patients, right? Because of that pharmacy distribution, because of treating it like other medicines, it has the longevity to stick around. Whereas oftentimes in the US, once a state goes adult use, the medical market more or less stays stagnant or starts to die. Again, because there's not that healthcare professional involvement. That's my personal opinion on it. So the European market, I think the reason they have that longevity is because pharmacy distribution. I think this is a clear opportunity for them. Also, when we move forward into adult use with Germany, I'll hit on this in a little bit, but that there should be a clear distinction between cannabis for medicinal purposes being offered in a pharmacy, cannabis for adult use purposes being offered in another retail location, okay? There's an opportunity for a clear distinction, where in the US, in a state like mine, Michigan, you go to the same exact dispensary, whether you're a medical patient or an adult use patient. Same place, major difference is the tax you pay, okay? Now let's take a little bit deeper look into that US market. Takeaway again from this section, Europe adult use cannabis markets will be more restrictive, will have higher quality standards, and less form factors. Current situation. Also, you'll see a lot of these pictures here are my pictures, okay? I was in Michigan for 3 weeks just recently, and so I visited a lot of, this is a dispensary in Ann Arbor, Michigan, to have a little bit of look inside. Also, you'll see here, I don't know where the, okay? So these are some extracts. You'll see these are vape cartridge extracts, you know, very branded as well, so Mitten, which is, we call Michigan the Mitten. And then here's some edibles as well. But currently, dispensing in retail stores, many different form factors available. Many states allow individuals to grow at home, and some states now have consumption lounges as well. Think of this as a cannabis bar. Here's a little video. It's only about 15 seconds long, but this is another dispensary in Lansing, Michigan, my hometown. This is quite a nice one. It's a brand new one. You can see that some people go quite far with this, right? And there's tons of different form factors that you're seeing. Pre-rolls, I mean everything, oils, vape cartridges, edibles. So this is what a dispensary looks like inside, okay? The owner needs a license from the state to sell, licensing like everything else. Most have an initial waiting room where you come in, they check your ID, you get through the waiting room, then you go into a large showroom like you see in the video where you can choose products, and then there's a counter where you can go and purchase. Clients are not allowed to use products in the store, okay? Who works in a dispensary? Well, luckily, Luna gave a great presentation yesterday about bud tenders. And this is the bud tender definition from Weed Map, so I'll read it to you. It's an employee who works at a storefront and represents the cannabis dispensary. Bud tender is responsible for educating consumers about cannabis products. While they are typically not medically trained, these marijuana dispensary employees serve as an important guides to using cannabis products and tailor their customer and patient services to all levels of experience. Here's some of the different form factors you'll see. Again, this is a photo from back home, but you got a vape cartridge here. These are 2 different cannabis flowers packaged, and then here are some edibles, 100 milligrams of THC, 10 different edibles with 10 milligrams each, but as you can see, a whole list of different form factors available in these different stores. Now when we look at the actual state of Michigan regulations, okay? You got to be 21 and up. You can possess up to 2.5 ounces. That's 70 grams. Within individual's home, you can grow up to 12 plants,
And you can also have up to 10 ounces, correct? 280 grams of flour. Now, anything over 2.5 ounces has to be locked in a lock or a safe, let's say. And individuals can also possess and manufacture and buy paraphernalia. Think of smoking pipes and vaporizers. When we look into the licensing, okay, it's regulated by the Department of Licensing and Regulatory Affairs. There's the MRA, which is the Marijuana Regulatory Agency that handles all of this. There's 6 different licensing categories. It encourages social equity, what we've talked about today. It's an uncapped licensing structure, which is interesting because I've seen quite a drastic drop in prices from when I was back home in August to when I was home just last month. So that's kind of interesting and something to keep an eye on, you know, what will happen with pricing when you have these uncapped licensing structures. And they're in effect for 1 year and then need to be renewed. Don't want to leave Canada out of the, not cannabis, it's definitely in the conversation, but don't want to leave Canada out of the conversation. Very similar, Ontario is the largest market in the Canadian market. It's actually the Canadian neighbor to Michigan, so very familiar with Ontario as well. Have a similar model, but it's a bit more restrictive. You can see less, you're able to possess less, you're able to grow more at home, but they also have multiple form factors available as well, so a pretty similar model. When we look at licensing as well, you can see that there's multiple different licenses available in Canada, similar to the Michigan market as well. I think they even have a couple more categories than Michigan, but that gives you a little bit of an insight into licensing in Canada. But here's some more insight, and I think this is quite an interesting slide, right? And again, I think it's because Canada does not have this same EU, more pharmaceutical-driven medical model. But you can see in this 2-year period, this is all on Canada.ca as well. They publish all this data, so you can go and look and kind of understand what's going on. But, I mean, you can see here, over this 2-year period, a small increase in medical sales, while in adult use sales, almost 100% increase, right, in the same exact 2-year period. So it shows that you really need this clear distinction because oftentimes, even in Canada as well as the United States, when that adult use market comes, the medical market seems to kind of lose steam. Finally, another interesting topic, though, of why adult use regulation is good, okay? I think this is also one of the most important slides of what Canada has shown here, but that at a point into this regulation, you finally see that the illicit sales drop below the adult use sales, okay? And that's what we're here for, right? This is the reason, right? It has to do with harm reduction, but it also has to do with eliminating this war on drugs, right? That's what this whole thing started for, was this war on drugs. So this is another option, and it shows that it clearly works, and it clearly slows down the illicit sales. Last section today, and this is more personal opinion, if you will, of what I expect to see in Germany, knowing what I know from the US. But the key takeaway, again, non-pharmacy retail store for the sale of cannabis for adult use purposes works well for distribution. I think Germany will make a humongous mistake if they offer the adult use cannabis in the pharmacy at first. Some stuff that I've read, I know in the beginning it was talked about more. It doesn't seem so much now. But I've still seen recent papers of lawyers and advisors in Germany that mentioning that it could start in the pharmacy and then transition into a retail store. But I think it's a huge mistake. Current situation, kind of talked on this yesterday. The regulators announced last year that they would move forward with an adult use regulation in Germany. We still lack a lot of information regarding what they're going to do. Said we do have the old bill proposed that kind of gives a bit of an insight, but as of right now, a lot of questions left to be figured out. We do expect to see something later this fall from the regulators, and it will be the first cannabis for adult use commercial market in Europe, right? We've seen also Malta and Luxembourg make some moves, but it's not a commercial market, right? I would consider it more a consumer-based regulation, which is also favorable as well, right? I believe that they're at least taking one step forward. So a couple different questions. Where is it going to be sold? Who will work in the store? Will they stick with EU GMP? What form factors? And how will licensing work? I'll run through all of these quickly for you. So again, I think they should consider the non-pharmacy distribution. I think it makes the most sense. They will have to roll out some stores, retail stores. I don't think you should be mixing both the medical use of cannabis with the adult use of cannabis. They've also mentioned there will be specific individual requirements within the store for employees, but no one has any idea what that means. Does that mean they'll need scientific experience? Does that mean they'll need medical experience, healthcare experience, cannabis experience? Who knows, right? So I think the challenge is there's a limited number of individuals with knowledge in this space, and that's why we're faced with this challenge moving forward into Germany and having some clear words like this. Who's that going to be? Will they stick with the EU GMP? I think there's a high probability, right? This has kind of been an established thing here in Europe, much different than what we see in North America. But I think it's quite clear that this is the standard moving forward for EU cannabis. We'll see what they do. I don't know if they'll, find something else, but that's what I believe. The challenge there, it's capital intensive. There are a limited number of manufacturers currently operating with the certification in Europe. So when they talk about that 400 tons of demand, if it's all coming from EU GMP facilities, it's going to be a bit difficult, but also a lot of partnering opportunities will be made available as well. What form factors should you expect? I think you'll see flour and formulated oils for sure, right? And I know yesterday we talked a lot about maybe just seeing flowers first, but they have experience with both flowers and formulated oils in Germany for 5 years, if not more now, right? So I think those are two things that could easily make the cut. I think vape should be in there as well. I don't think they'll make the cut in the beginning. I think they should. It offers non-combustion opportunity for the inhalation of cannabis, so I think it's a good thing. Edibles, drinks, and other food-related products, I think that'll be much more complicated and will take a bit more time to figure out how that works and get those implemented into the market. How will the licensing work? This is, again, I don't really have a great idea yet, but again, it will be distributed in specially licensed shops. They never mentioned, though, will this be a pharmacy or other retail store? So we'll have to wait and see, right? Again, that expected demand is 400 tons a year, which means I believe Germany will have its own cultivation and manufacturing in the national territory. There was some reasons yesterday mentioned why it's not economically the best decision, but I think they'll have it in-house. I think they'll cap the licensing, but ultimately, because of that supply challenge, they're going to depend on imports quite a lot, which is why depending on some of the treaty stuff that Alfredo mentioned, Portugal could end up playing quite a big part in that. Final takeaways that I have for you today. Germany will set the standard, I believe, for other European countries. I believe other European countries will implement regulations after Germany. Germany is a powerhouse, large country. I think once they set the stage, it'll make it much more easier for other countries to kind of follow along, if you will. And then I think it'll be more normalized as we move forward here in Europe. Again, right now, still the focus, especially in a place like Portugal, is medical access for patients. We're still not doing well here. We still have tons of work to do here. But we also have to realize that this is coming. This is on the forefront, so we need to be prepared for an adult use market here in Europe as well. So thank you, everyone, and I'll take any questions.
Thank you. Thank you, Stephen. So questions and answers, here we go. There you have.
Hi, Stephen. Thank you for your insightful presentation. I would like to ask you, well, you are clearly advocating for a clear distinction between retailing medical cannabis and adult use. It's clear for me. What about production? Do you think regulators will, so do you think that in terms of production, regulators will enforce that the production should be made in different facilities, or it could be made in the same facility? That's the question.
Oh, thank you for the question. It should be in the same facility. There's no reason to have another facility for, again, it's all cannabis, right? It's the purpose and the use that matters, right? It's the end distribution to the what client sector is it going, or consumer sector is it going to, right? That's the important thing. There's no reason to then have the extra money going into building more facilities, bigger facilities, more energy, more consumption. It doesn't make sense, right? They should allow the operating medical to even if they have to get another license, whatever, but to be able to operate in that adult use market as well.
Thank you. We have another one there.
Hi, Steve. First of all, thank you very much for bringing such good content. And thank you very much also for emphasizing so much the medical side. I think it's perhaps we are all here mostly for the medical side. And I would like to do make two questions. One is regarding the ACM, the marketing placement authorization. What are the biggest reasons for Tilray having only one product approved? If it was mostly because Infarmed are putting too many regulations, or was an internal decision from Tilray? And the second question is, in our neighbor country, Spain, I think they are now having a huge discussion in the parliament. What do you think about the medical market in Spain for cannabis products?
For sure. Yeah, no, my pleasure. I'll start with the first one with the ACM. So this is challenging, and what I want to, and because we talked about a lot about this yesterday, so I think it's very important, is that regulations from country to country in Europe are much different. Okay, and if you look at the process for registering a product in Germany, and compare it to the process to registering a product in Portugal, it's much more difficult, okay? The quality standards are even higher, specifications, they follow the module 3 of the technical document, which is the same technical document that they use for all of their medicines. So one of the bigger challenges with cannabis is keeping that consistency, right? And a lot of companies are, like I said, this is newer in this more highly regulated market. So a lot of companies with experience in Canada and the US didn't have to have these tight of specifications. So really, like I said, it's learning on and understanding on the producer and manufacturing side, and then also there's the regulator component of just having extra difficulties, right? And when, like I said, it's difficult, right? But I'm a business guy. I come from finance, so we also have to understand the reality of this, right? So you have an easier market to register a product with 80 million people, and you have a harder market to register a product with 10 million people. If you're the owner of a company, where are you going to register a product? I mean, seriously, where are you going to register a product? Okay? I think that's most important, right? So everyone needs to realize that. So the regulators need to work better with the manufacturers, with the cultivators here in Portugal to make these products available in the market. It's not just the producer's fault. It's not just the regulator's fault. They all need to work together.
Thank you.
Thank you. And just quickly on the second question? Spain. Okay. Spain's interesting, right? So I spent as Tilray, as the country manager, I spent time in Spain as well. I sat across the table from a director of the AEMPS, which is the health regulator there, telling me that there's already a clear way to register a cannabis product in Spain. Okay? And so this is this is what I feel their position is, right? They are debating it more now, but for the last years, this has been their position. And it's interesting because GW Pharmacies, that's now owned by Jazz Pharmaceutical, does a lot of their clinical trials there in Spain. So I have my own little speculations of why Spain is holding back a bit on their medical cannabis regulations, but that's for another day. So yeah, I think they'll pump the brakes as long as they can.
Thank you, Steve. Any other questions? There's two more, one here and one right over there.
Hi, thank you very much for your presentation. My name is Ricardo. I have a question regarding, further side of Europe. When we think about what's happening in Germany and the potential development of the market there, do you have a vision on what may happen to Poland and what be the decisions of the Polish government regarding the market, and how it can threaten the investments in Portugal?
You know, it's a good question, and I think I talked to one of your colleagues about this the other day. But yeah, it's interesting, right? Because the Poland market is starting to develop on the medical side as well. When I was with Tilray, we were working on that quite a lot. So it's interesting, you know. I still think, but I still think you're forced to do indoor cultivation, which is good, okay? But also there's other economical ways to cultivate cannabis, right? And much more cost-effective ways to cultivate cannabis. So I think Poland still struggles with that challenge, having to have mostly indoor production, right? And then what's the knowledge base there? You know, I think yeah, labor costs are lower, but then what's the knowledge base? You know, what's the professionalism of the health care professionals there, right? Or understanding of adult use market moving forward. So I think they could be a player, but I do think that Portugal, because of its runway, has established itself as a strong cultivation manufacturing country in the European Union for this market. And again, you know, I think some of that then, but again, there's this part on the regulators, right, where we need to get some things cleared up. We need to get patients access to products. We need to get them in the market, or else I think the only threat is operators getting a little bit discouraged maybe with Portuguese regulators, okay? This could be a potential threat in the future, and then they look to go somewhere else. But still, I don't know if Poland will be the first option, but it's definitely on the table.
Thank you, Stephen. And last question, one last question.
Thank you, Stephen, for your presentation. One question that
I am sorry, a little bit louder.
One question that I'm very curious after being in the United States for quite some years, learning more about this plant, and seeing that here in Europe we are in a very initial phase in terms of research. Do you think, considering your title, One Plant, Different Regulations, and seeing here Europe and North America, do you think it will be possible to dream with one regulation between these two places, like North America and Europe, considering like trading in this market, you know?
I think it'll open up for trade, right? I think they'll always be regulated different. I think the European Union just looks at things different than North America or the U.S. government, right? Especially when it comes to quality standards and things like that. So I never think there'll be the exact same regulation. I think it will open up the trade, though, possibly, right? And I think what's super interesting right now is when I go home in North America, they have a lot of knowledge and experience in form factors and manufacturing, different products available. What everyone kind of forgets, though, is that you're locked into your state. So even if you want to operate in another state, you have to actually have a partner there that produces the product, or you have to actually cultivate and manufacture in that state to operate it. So no one in the U.S. is really getting a grip on the global trade of cannabis, where everyone else playing in this global medical market, Canada, South America, South Africa, Europe, Australia, is understanding the global trade of cannabis. So, you know, we're getting that advantage. If the FDA move forward and put forward some medical regulations, then I think this would be possible. You'd have imports and exports, you know, much sooner, right? But then when you move into adult use as well, if we have a national regulation, that's the thing in the U.S., it has to be a national regulation for them to do anything globally. If it always stays at this state level, it'll remain just the U.S. thing, right? So that's the key. I mean, first, the U.S. needs to take more federal level execution of this. And I mean, first, it should be medical cannabis, obviously, and so that they can start to get into that trade and share some of the knowledge that physicians have there, and also learn from what's going on here in Europe.
Thank you, Stephen. Please, an applause for Stephen. Thank you.
Thanks, everyone.
And it's now time for the coffee break. We're back at 11:15. It's sponsored by AgroPharma and Cannabis. And please, for the people with VIP boat party tickets, stay for a couple of seconds to have all the instructions you need to use this wonderful party. No, some people are staying. Okay, so for the VIP boat party tickets, the meeting point will be at the deck at 4 o'clock, 16. The boat will leave at 16:20 and will not, I repeat, will not wait. Again, it's a bit different from this room where you can arrive 5 minutes later. And again, unless you're a great swimmer, you better be there at 4 or you'll lose the party. It's really important that you use the app. In the app, if you choose the option venues, or in Portuguese, auditórios, you will find everything you need to reach the place, including automatic GPS from wherever you are, driving you there. The boat name is called Catamaran Gaivota. It means seagull in Portuguese. If you have any further questions about these, in order you do not miss the party, don't hesitate to contact any member of the staff and they will help you. So have an healthy, good coffee break. Thank you. Welcome back, and I hope you enjoyed your healthy break that was provided by Veganish. Everything we had is vegan, so it's really healthy. And meanwhile, because during this coffee break, a lot of people came and asked or comment my socks. So let me tell you that all speakers were presented with socks from Insana Flora. They were given by Daniela, so there you know where you can get socks like these ones. Also, they got a bottle of gin of Cana Gin. They got cookies from Luis, 6 Sentidos, and hemp tea from Elena at Empology. So we're lucky, especially with the socks. Now moving forward, I guess we have our speaker ready. Shlomo. Yep. He was born and raised in Jerusalem, Israel, and has graduated from the horticulture program at the Jerusalem Technological Institute. He has more than 30 years of experience working with profitable large-scale commercial operations and unique familiarity with the cannabis industry in both Canada, Israel, and South America. He has also worked in Australia and Portugal. He is currently engaged in several international cannabis cultivation projects, providing guidance on GACP compliant medical cannabis cultivation. So let's welcome Shlomo Booklin from Juicy Fields. Welcome.
Bom dia, eu vou tentar falar inglês. Yeah, my name is Shlomo, and I've been growing plants for the last 30-something years. But before I start, I want to talk a little bit about COVID and medication. So, thank you. Some of you remember, I don't know if we can even forget, that, a year ago, 2 years ago, we had lockdown. The first lockdown, the second lockdown, everything was shut down, maybe supermarket, petrol station, pharmacies. And in Canada, Toronto, we also had dispensaries open. And everyone in the cannabis industry was so proud that, wow, dispensaries are open during COVID. We must be important. So, yes, it's important, and it's open just like pharmacies because it's medicinal. And this is double-edged sword, because if you important, or if we important as medicinal, and we open during COVID just like the pharmacies, we should apply the same standard to ourselves. And basically, this is what I'm going to talk today. So, we spoke, my dear friend, colleague Steven spoke earlier today about regulation. Luna spoke yesterday about lack of regulation. We spoke about the lack of harmonized in Europe between countries. So this is basically why I wanted to talk. I'm agronomist, like I said, for the last 35 years. I only do commercial and growing and cultivation. I am not really into the marketing. I'm not into the financing. I am just agronomist. So I'm looking at growing from the regulation point of view. And basically, we have the GACP. GACP is basically good agriculture and collecting practice. It's been originally written by the World Health Organization in 2002, and it's been revised again by the EMA, the European Medicinal Agency, in 2012. And basically, it gives the guideline on how to grow and cultivate medicinal plant, and cannabis as a medicinal plant fall under that umbrella. So the talk will be GAC, why, and how. So why is, if we're looking at what happened in places like Canada, of course, Israel, Switzerland recently, and other places, if you want to buy the cannabis, whether recreational or medicinal, you have to buy it in a specific place. Either a dispensary, like we said earlier, or in a pharmacies. And we cannot expect that pharmacies will have black market product next to the pharmaceutical product. So if we looking at selling this product that we grow, we have to comply with minimum standard. And again, we talked about regulation, what will happen in Germany, how the European regulation will affect, etc. I fairly confident that the minimum standard will be GACP. And if you want to sell your product, whether it's in Portugal, whether it's in dispensary in Amsterdam, or whether it's in pharmacies in Switzerland, you will have to comply with at least GACP and most probably GMP, but we won't go into GMP yet. GMP is basically pharmaceutical standard. But let's assume that, like I said, and I'm fairly confident that the minimum standard will be the GACP. If you won't meet those standards, you won't be able to have your product anywhere, nowhere on the shelf. So this is why. How is the biggest question is, how do we apply pharmaceutical standard on botanical crop? So we have tomatoes, right? And we have ketchup. We know that ketchup made of tomatoes. We won't tell you how to grow the tomatoes, but the ketchup has to be comply with some standard. With cannabis it's a little bit different because we can use not only the ketchup, we can also use the flowers itself, the cannabis buds. So again, we have to tell you, or we have standard that we have to meet when we're talking about how to grow it. So it's not just like the tomatoes and the ketchup. So, you know, like I said, the main thing is how we apply pharmaceutical guidelines on a botanical crop. And we have a bridge. It's the 25 d'Avril, just around the corner there. So you see that you have two. It's not like Vasco da Gama. It's a smaller bridge. So we have two pillars to that bridge, which is on one side, like you see over there, we have the botanical crop. The main pillar will be GACP, and you have to cross the second pillar, which is GMP, and then you'll get to the pharmaceutical product or pharmaceutical grade. And again, if we're looking at production flow, you can see that anywhere from the mother room, the propagation, the growing room, whether you have 1, 10, or 15, or whatever, until the harvest, it goes under the GACP. And then there's an overlap of the two section, or the two round red circle. You have the the primary processing under GACP still, but as soon as it goes into the dry room, you have this transition between the GACP and GMP. Then it goes into dry room. If you have the final product as a dry product, then of course it goes into the storage and shipping. If you have extraction, then it goes from the dry room into the extraction. Then you have the final product, and the same thing, the storage and distribution. So this is basically the production flow, and of course we can go into details in much more each one of them, but like my friend Alfredo spoke earlier this morning about the convention, the single convention, we have the GACP, which is the pizza, and around the pizza there is the crust. Obviously, it's not here, which is the regulation, which is cannabis considered to be a controlled substance. So that's the crust around the pizza. But we're talking about the pizza now because we're talking about GACP and the single convention and all things that are related to the controlled substance are not part of the GACP or the EMA regulation. So we have a couple of things. To make life a little bit easier, and I don't have that slides here, but imagine that we can decide, divide those pizza. Before we slice it to 16 or 12 slices, we can divide that pizza for 4 quarters. So 1 quarter will be sanitation. The second quarter will be quality. The third quarter will be production. And the fourth quarter will be a record keeping. So sanitation, it's kind of straightforward. We don't want our medication to be done on on the floor of the fish market in Jakarta. Trust me, I've been there, it's not clean. So when we have a product that is pharmaceutical grade or GACP grade, we want to make sure that there's sanitation, whether of the employees or the facility, has a minimum standard. So it's kind of, we take it for granted. When I swallow antibiotics, again, I trust that this meets some kind of standard. The second quarter, like I said, is quality. So quality, again, it's kind of straightforward. We want to make sure that the product that I use is high quality, it's efficient, it's been safe, it's ready to use, and it's meet the standard that it's actually good to be considered as medication. The third part of the party, the pizza, sorry, I'm already in the party stage. The third part of the pizza is the production. So that's basically everything that goes from the seeds to the cultivation, to the harvest, primary of processing, and everything that I showed in the previous slides about the whole production. And then, like I said, the quality assurance is the second part. The hygiene and the building and the equipment is also part of the quality. The last important part, which is not as, it's important just like anything else. I don't know how many of you know the Khalil Gibran. He's an author from the early 90s. He's from Lebanese origin, and he's basically the Mediterranean version of La Fontaine. So he wrote short stories, and in one of the stories he said there was a tree in the forest, and every part of the tree wanted to make sure that they are the most important part. So the trunk said, oh, I am the most important part because I carry all my trees on my back, and without me, you're nothing. The root said, no, we are the most important stuff because without us, we make sure that the tree is standing tall, we provide food and nutrition for everything, we are the most important. The branches, of course, agree with the trunk because they also carry the weight. And then the leaves said, no, we are the most important. We do the photosynthesis, we are providing shade, of course we are the most important. And the flowers said, oh, come on, well, of course we are the most important. We're so elegant, we have the perfume, we make sure that, the next generation, and so on. So the fruit said, no, we are the most important because without us there's no continuation to the seeds, etc. Obviously, they couldn't agree who's more important, and they all striked, and the tree died. So, like I said, it's not more important or less important. They're all equally important. You have good quality product. You have good hygiene. You have excellent facility and propagation and everything. If you don't have the record keeping, you're nothing. You might have, shitty products, very good sanitation, etc. Excellent record keeping, but again, if your quality is not there, then you maybe need to change your profession. So again, those four elements are intertangled that you cannot really say one is less important than the others. So this is where the four elements of the GACP comes together, and of course here they divide it into the 12, because this is, if you look at the EMA regulation of, like I said, of GACP, it's divided into those 12 subtitle. So, that's, like I said, the breakdown is basically the four elements of the GACP, which is quality, sanitation, production, and record keeping. The general, of course, you have to describe what is your location. If you want to do the application, you have to make sure that the land registration and it's properly for your facility. You have to get the municipality authorization to have this facility on that particular plot of land. You have, of course, to have the building permit to build the facility. And another point that regulator looking into, especially if we're talking about Infamed, is how the security and how is, for example, the proximity to the police station, etc., to make sure that you're within normal reach. The quality, like I said, you have to have the qualification. So every facility should have a qualified person that do the authorize the release of the final product. And every you have to have lab testing, which is basically we call it certificate of analysis. So when you have a batch, you have to send it to a lab. A lab will test it and it'll give you a certificate of analysis. That certificate of analysis will say how much % of THC, how much % of CBD, CBN, terpene profile, etc., etc. With that, assuming that you want to go to Germany, you present that COA, the certificate of analysis, to your importer in Germany. They request an import permit. You'll get the export permit from Infamed, and you get the permit to ship that specific batch. And of course, you need to do the batch validation, but we won't go into this thing. The other point is, you want to have, and Robert, my colleague earlier mentioned that the fact that we need to have some sort of personal availability to do this properly, and he was talking about pollen, etc. So of course you need to have the personnel. The building, like I said, it's again you need to have the sanitation. Like I said, then the equipment for you need to have a bucker, twister, etc., etc. And documentation, again, it's the log for everything, or batch record, etc. The last important, of course, the seeds, origin of seed, and for the phytosanitary, import permit, etc. It's important. Stability, of course, is very important. And that leads me to the next point, which again, it's important, and I hope that the time will permit us to cover it. When we started, we, or as a humankind, started with the automobile industry in early 1900s, 1920, 1930, or 1890, etc., we had more than 2,000 companies that produce cars. 2,000. Of course, today we can remember, I don't know, 5. Toyota, Subaru, Renault, Volvo, but 2,000 cars, or 2,000 manufactured cars we had during the early 1900s. Henry Ford decided to do a production line. So every car that he made was consistent. And that's why Ford became such a major force in the car industry, because they are the first to implement a production line that you build those facilities again in labor. It was very, you save a lot of labor. And of course, the end product will be always the same result. So the consistency, and again, my colleagues all around what we heard the last 2 days is the lack of consistency. So the consistency is very, very important. And the consistency we can only get if we apply SOPs. So, when we look in at, I don't know, McDonald's or Coca-Cola or Hilton or Starbucks, whether you go to Starbucks in Manila, Tokyo, obviously not Moscow anymore, but Amsterdam, Toronto, New York, it's always the same. Before you get to be a barista at Starbucks, you go and read 2 weeks or the SOPs on how to make coffee or how to make latte. We have to have the same standard in production, that if we do the same thing with the same genetics, and we will get the same results. So this is the consistency that, like I said, Henry Ford figured out in the 1930s, and the Starbucks today, and the Hilton. I mean, again, if you go to the Hilton, again, whether it can be Sydney, Australia, New Zealand, Los Angeles, or, I don't know, Vancouver, even the music in the elevator is the same. So the consistency is extremely, extremely important, and that's why we have to follow really, really strict SOPs in order to get the consistency and the stability. And that, again, goes back to the seeds, right? So if we have the same genetics, and we continue with the same genetics, and we do the same condition, humidity, irrigation, fertilizer, etc., we will get this very similar results, and that will create us, that will give us the next stage of where Ford with the car industry did many years ago. So we need to comply on that. The cultivation, like I said before, it's straightforward. The harvest, again, you have to have it by batches, not to mix up. You have to wait. What is the weight? What is the dry weight, etc. I know I spoke a little bit too much, so let's have question and answers. Please. I knew I'd break something.
I am sorry. Here I am. Questions and answers are open.
Oh,
right?
okay.
Okay, go ahead.
So that
There,
okay.
right over there.
Okay.
It's not work. Okay. Thank
Okay.
you. I would like to make a question, and first of all, thank you very much for all the information. I can see lots of people talking about the outdoor production when the market is only legal for medical purpose. I know Portugal has amazing weather conditions for outdoor production, but I can see also in other regions in the planet with the same solar exposure, but still doing indoor production. What is your opinion about indoor production comparing to outdoor production? And since we have a medical market, what is the purpose of doing outdoor production when we can control and have the stability, the consistency, the quality of doing indoor production? Thank you.
It's a very good question and a very valid question. Like I said, I am growing plants for the last 30 years, and for me, the bottom line is the most important. If you're not profitable, we're not a charity organization, so we have to be profitable. Obviously, in Portugal, and I've been in Portugal many years, that's why I speak Portuguese. Obviously, in Portugal, you have amazing weather. You have amazing sun. I remember even in January, February, I couldn't go to the beach in Setúbal. So you don't have it anywhere else. So the sun and the light is definitely one major factor. Obviously, we have a relatively low production cost in terms of labor. Labor is normally consists of 55% of your cost. So, you know, I'm Canadian, I'm proud to be Canadian, but there's a reason why we don't grow mango in Canada. I mean, summer for us, some people say this is 7 weeks of bad ski. So, I mean, again, we don't grow mango and avocado in Canada because of the same reason. It's not financially feasible. You have all those reasons to do it in Portugal. In respect to your second part of the question, why indoor and outdoor, it's same and not the same. So again, if you have greenhouse that you can control everything, including the humidity and everything, why not have the light for free?
His question is regarding the main purpose.
Yeah, well, again, if you meet the standard, if you meet the standard of the GACP and GMP, the client wouldn't ask you if you grow it indoor or outdoor. They will say if it's meet the standard, it's okay. So it comes down to the cost.
Okay.
Thank you.
And your personal opinion, by the way?
Of course, again, as a agronomist, I think there's nothing like sun. And plants and sun have been together for the last 50 million years. They've done it before it came to the world, and they will continue to do it after. So, you know, you have LED, you have all kind of lights, but it's artificial. I think there's nothing like the symbiotic that we have for the last, I don't know, 50, 100 million years between plants and sun.
Thank you. Another question? Anyone? Please raise your hand if it's the case.
Some people promise me very hard question, and I think they shy.
That will do it after, in a more reserved way.
Okay.
So an applause, please, for SHLOMO. Thank you so much. Thank you.
Thank you.
Moving forward, Jaime is an expert in business development in regulated sectors, graduated in law from the Complutense University, executive MBA, and postgraduate in political communication. He understands the political, legal, and business environment in Spain, Portugal, Morocco, Africa, and the Middle East, being currently the senior advisor of LLYC and AgroFarm. So please welcome Jaime GIL-ROBLES. Coming with José Maraver.
So, okay, works. Thank you very much. Thank you, the organization, to invite me to participate on this speech that's supposed to be a chat with José Maraver, who's the CEO of Cannabis, one of the medical licensed company here in Portugal. And the purpose of the meeting is to share with you our experience on how to develop the business. Sorry. Okay, that's fine. So, as was mentioned, the purpose of this chat with Jose is to share experience with you on how complicated it is to run and to get a medical license cannabis and to get profitable business. Okay. Prior to that, I would like also to introduce AgroFarm. AgroFarm is the company when I'm working with them on supporting all the conversation that they have with investors. AgroFarm purpose is to cover at 360 degrees all the cannabis business, from legal, from business perspective, from lighting, from electricity, genetics, climate, all the things that you need, or all the farmers or the investor need to run a medical cannabis business in Spain and in Portugal, where they have a large experience. If I'm not wrong, it's running at least 3 cannabis licensed companies in Portugal, but they're also working in 2 other projects in Spain. Okay, so welcome. Thank you for coming, Jose, and to share with me this chat. If I would like to start, it's what is for you AgroFarm?
Yeah, thank you for the invitation, Jaime, to speak today at Portugal Medical Cannabis, and I'd like to congratulate the organization also for the event. As you mentioned, AgroFarm does cover the whole process from construction to implement a medical project in Portugal. And instead of dealing with a few companies, you can just rely on one company and they'll cover the whole process from planning to execution. They can help you out also with genetics and other kind of contacts that you will need to set up a project in Portugal.
So how do you arrive to AgroFarm? Which was the momentum in your business when you decide that AgroFarm can be your partner?
So we had our project was designed by us, and we were looking for constructors, but we couldn't find a company that was able to manage the whole process. For some of them it was so new, for some of them it was so complicated. Then we luckily met Rafa from AgroFarm, and since the very beginning it was a no-brainer for us to come along with AgroFarm and develop our project. They do understand all of the technical details and the discussions with them were so interesting for us as well.
Yeah, so you mean for you guys, you have running your own business, so Agrafan helped you to finally move what you had in the business plan to become real?
Yeah, we had everything was planned and designed by us, but no company was able to build our project the way we intended.
Mm-hmm.
So it's only because AgroPharm appeared that we are able to be constructing now our facilities, our dream facilities, and they've improved a little bit our facilities as well, because it's been a few months discussing the technical details, and this is always changing and evolutioning, so next year we will be optimizing our facilities as well. This is a long run.
So because at the end, as you and I live this experience to have the tough pressure of the investors, and business plan looks always lovely, but the reality is when you start building your installation or to found providers, it's always a little bit mess. One I recognized when I was starting working with them is they provide me all the solution that it was quite difficult for us, and I'm coming from the business side, so the business side always don't have the full picture about all kind of provider. That was also your experience?
Yeah, this is not something you can do in a couple of days back home. This is a few years process to set up a project like this. Not only in Portugal, but wherever you want to set it up. And we've been discussing for a couple of years with AgroPharm. I see Rafa laughing back there. And it's been a lots of discussions. We went into all the details. Of course, we have to. Of course, we have to. Not working now. I lose the lead, but I think I was talking about how complicated it is to bring a project alive. Of course, we have deadlines, we have objectives in mind. We would have loved to be in the market in 2020. It's just not so easy. We had COVID and everything. We have investors, and we have to give answer to the people, not only the investors, but the workers at the company. We have our patients in mind. And of course, this is going to take you a long time. It's been 3.5 years for us. It's not easy. Every day we have to work a lot to make this happen. And from outside, it might look so easy. There is a nice video playing on the back, and it looks like everything is done already. But we are encountering problems every day, not only at the construction side, but on the regulation side, everywhere. Luckily, AgroPharm has a huge team, and they are working with a couple of companies. So they do provide every solution that is needed. I'm trying to think about problems that we found during the construction. Biggest problem is that a couple of days ago we had a thunderstorm, and during the evening we couldn't move along with the work. That's all the delay we have. So AgroPharm is really excelling in the execution of the project, and I hope to be able to kickstart production by October.
So in this line, which are the main objective of Cannabis? Of course, keep confidential what you need to be confidential, even if we are surrounded by friends.
Not many things that are confidential. I think it's very clear our objective is to supply the medical market. We're focusing in Europe, no intentions to go outside of the EU border. And we intend to be market leaders in Portugal and Spain, which is our home countries, right? Obviously now the biggest market in Europe is Germany, but all the DAC German-speaking area in Europe, they are developing the industry, not only the medical. And Switzerland, Poland, the UK, or Germany are the main markets at the moment in Europe. I was listening yesterday to the talks here, and there were many people asking, why do we not have products in Portugal? It's on our side, on the company side, of course. It's not easy to register a product in Portugal. We are not producing yet, but as soon as we harvest, it's going to take a couple of weeks for us to bring the product to Germany. In comparison, it's going to take 6 to 9 months to register a product in Portugal. So we will be working hard to register in Portugal, but expect Canaveira to bring products outside of Portugal first. The same as all of the other companies. We have here Steven George. He was the first person in Portugal to register a product. I've talked to him. I know it's not easy. It's not a problem with Infarmed. They could make it easier, but it's on our side. We have to register the products. It does make sense, and it's one of the most advanced ways to access cannabis in Europe. So I think we should keep on pushing and expect our products to be in Portugal as soon as we are able.
So I'm fully agree with you and with Steve. I think the future is we have a lot of licensed medical companies already in Portugal. There is a potential in the market. I think definitely we need to work with Infarmed. But speaking about Infarmed, how was your experience with Infarmed? I don't know if there is somebody from Infarmed here. We will be very politically correct about that.
No, but because it's so easy to be politically correct with Infarmed, because I'm originally from Spain. The medical agency in Spain is so secretive. It's so hard to talk to them. Their interpretation of the law is so complicated. And I'm really happy that I came to Portugal in 2018 to set up this project, because not only Infarmed, but all of the regulatory agencies and bodies in Portugal, they are doing such a nice job. Since 2001, Portugal has been leading the reform when it comes to international laws and drug regulation. In 2018, Portugal demonstrated again that this is a leading country when it comes to modernizing society. And I think all of the authorities are being so responsive, working on time. We have no delays with Infarmed. It's very clear from their side as well. And I'm very happy to be working with Infarmed and not in Spain.
Well, definitely, I think we all agree that for investors seems easier to work in Portugal than to do it in Spain. And I think numbers are very clear on the number of licenses and the developing. But following on the conversation, I think we all, this new regulation in Portugal, do you think it will be an opportunity for the current medical licensed companies?
You mean the recreational? As I was saying, Portugal has been leading since 2001, and it's been already 3 or 4 years we're discussing in the parliament the recreational reform. There is some examples already in the world, like Canada, Uruguay. Switzerland is developing now a program, or the Netherlands. And again, Portugal is probably the most serious country when it comes to regulating. We are in the European Union, and the authorities here are so responsible. It's a no-brainer that legalization is going to come. Not today, not tomorrow, but it's going to come someday. So I don't see why not regulating cannabis for adult use. I do think the government is going to be responsible, as they've been already. And yeah, I'm all about it.
Yeah, I think maybe we all agree that if Portugal already developed a cannabis industry, a medical cannabis industry, it will be logical to understand that these local companies that generate employment and richness take profit also of this business. But do they need the industry to show examples of how to do better and how the market is supposed to be for this recreational? Because we know that they want, but nobody has a clear idea of how they want. In the ideal world, if you were able to write the law, how do you can imagine the reality of this recreational market?
I'm not a legislator. I have no idea how it's best to regulate an industry like this. From our user point, I think it's obvious we need to regulate cannabis for adult use. It's only going to be positive for society, for the user, for the government. It's going to give back lots to society. Canaveira, we're focused on the arena. If recreational comes online, we will have to think about it. We will probably come online also, but we're not focused on the recreational at the moment.
Great. So if we make a step back, one of the things that we have this conversation with the investors is always based on the location. I don't know if you had this experience, but some of the conversation that we had in AgroFarm with investors, they always said, okay, I want to create an installation in my land because it's a lovely land, because I'm the owner, and how complicated it is to find the correct location for a medical cannabis installation. Which, under your point of view, are the key requirements if there are investors on the room, where you need to pick this piece of land?
There is no perfect location. You will always face problems. You will always have to tune your facilities and genetics to be able to grow cannabis. But as Shlomo was telling, you don't grow mangoes in Canada. So this is the big picture. I've been farming tropical and subtropical crops for the last 12 years. And obviously cannabis does not grows the same everywhere. I see many companies in Portugal, they are located by the ocean. They might think more temperate temperatures is better for them. Humidity is gonna be so tough to overcome. Your facility is gonna be prepared to support the salt from the ocean. We are located in the interior part. It's desertic, but we have bigger range of temperatures than in the coast, but it's so dry during the winter and during the summer. We have 280 days a year of sun, little rain, lots of water. It's one of the most prolific agricultural places in Portugal, Beira Baixa. And location is key, but you will always face problems. So if you don't know how to grow cannabis, just look for someone that knows how to do it. If you have a property already, it's probably the worst property you can set up the project, because it wasn't bought for this. So take your time, look for the place, think about all of the possibilities, what's gonna happen. The ocean is not good. They call it ocean grown, OG, but it's because it was so hard to grow by the ocean. So don't go close to the ocean.
So that is also a very good piece of advice. What about the relation with the local authorities? I remember when we started our project, it took 2 years to find the proper location because you need electricity. No simple point of electricity. We need at least 2-3 cabeas at minimum, and not all the electric network in Portugal can cover these needs. You need water, but I think we always forget how important is that the local authorities support the project, because if you don't do it properly, it could be an issue, a political issue, a social issue. So you need to be aligned with the political of how was your experience?
Yeah, absolutely. I think you guys seen Fundao is sponsoring this event, and this is amazing for us that the municipality is coming and showing support for the industry, not only for us, but the whole industry. When we arrived to Fundao, they had no idea about cannabis, but they were so open to listen. They welcomed me in the incubator of companies in Fundao, and they were such a nice, huge help for the project. Lots of advising, lots of contacts. They helped us looking for properties, and they are still working for us, or with us, kinda, no? And the other companies in Fundao, because this is not a one-to-one relation, this is for all of us. I think it's key that authorities, including municipality of Lisbon or Fundao, they do support the industry wherever you are. I've heard many problems in some locations, but all I got is good words for Fundao. Fundao is not just the cherry place, but it's becoming the cannabis place. You can go here in Cascais and buy cherries from our place, so soon you'll be able to buy cannabis too. And this is something the municipality is so proud about it. So I think this is the way forward, and we should all look for situations like this.
It's important also to mention that we really see a huge, a lot of medical companies that are investing here. We are still found enough talent to cover the key positions, but it's quite tough to find people. There are licensed on pharmaceutical with degrees on quality. That's a key element, and the experience. So Portugal seems to be still be, or do you think the wave already finished? Do you expect more medical companies try to ask for new license?
I hope so. Like many people tells me, aren't you worried that there is many companies in Portugal growing cannabis or trying to grow cannabis? I mean, you cannot call it an industry unless you have an industry, and the industry is supposed to be made out of companies. There is no market if there is no companies. There is no companies if there is no market. We need companies. I want to look at Europe and see how Portugal is the epicenter of the cannabis industry. This is only going to happen if we have 100 companies, 200 companies, manufacturing companies, cultivation companies, distribution companies, and I'm all about it. I want to see them in Portugal, not in Spain.
Definitely, definitely. We are all agree on that. So, Jose, thank you very much for sharing this chat. Hope it's been useful for you. Maybe there is somebody who wants to make questions.
Yes, we have right over here, and in here, it's coming, the microphone.
Estando som. Hello. Thank you very much for your sharing. I would like to take this last speech about the difference between Spain market and Portuguese market. Once you work, if you know a little bit about agriculture market, in Spain, we face a lot of cooperatives, co-working. They work very well together. Unfortunately, here in Portugal, the agri-pharma business, they are very straight on their own business. How you can achieve this really cooperative market to put Portugal, in fact, with the flag of cannabis for the market?
For me?
For sure.
Yeah, so I've worked with cooperatives in the Canary Islands for banana and tomato and avocado. Yeah, you're right, there is many cooperative spirit in Spain. We do not have it here in Portugal. It hasn't worked historically in Portugal. But when it comes to the cannabis industry in Portugal, we do have an association of producers. Canaveira is not part yet of the association, but we intend to be part of the association. And this is a forum to discuss and organize it in ourselves. On the side, I try to do networking all the time. I invite everyone to our table to sit down and have lunch with us. And I try to connect everyone also. I think you know that, Fabrizio. So I think this is the way forward. Like, there is no competition. I see no competition. There is lots of space for all of us in the market. All we can do is synergies and strengthen each other. I want to see Portugal like as a company, not myself as a company.
Thank you. More questions? Please raise your hand. So, yeah.
Thank you very much for sharing your experience. I think it was Steve talked before about how GMP operations are very CapEx intensive. From your experience, how was the fundraising process and what advices could you share with us? Because I think that perhaps is the most difficult ingredient. And if you may, I also will make another question. JAIME talked a little bit about this problem. We are facing now in Portugal a huge problem regarding qualified labor and non-qualified labor. Since you are building an operation in Fundão, what strategy do you foresee for your project regarding recruitment? Thank you.
So regarding the fundraising, there was a time where there was lots of money on the table. Other days there's no money on the table. We had a big problem in 2020. 18 March, we were supposed to close with the bank financial offer from them. 13 March, the whole world closed down. We stayed for 6 months trying to decide what to do from home. After that, we decided to go holidays, kind of, just leave it on pause for a couple months. And only last year, we kickstarted again with the project. So we started the fundraising. I've heard many options. You can buy companies, you can buy a license, you can buy a property only, or you can invest in a team, right? And this is linked to the next question. Investors invested in our team, not in the company, not in the license, not in the place, right? So how do I see it? We choose the location is 5 minutes from Fundão. There were other places that were 30 minutes from Fundão, but 75% of the team, we already have it. It's people we have worked for the last 10, 15 years with. On the other hand, the rest of the people is going to be local people from Fundão. There is a couple universities in Fundão, not in Fundão, but in Covilhã, Castelo Branco, which are 20, 30 minutes away from us. And they are so strong in biotechnology and pharmaceutical science. So we have pretty much all we need in Fundão. Come to Fundão.
Thank you. Any other questions? A yes in the back. Can you raise your hand again, please, so that it can see you? Okay, thank you.
Yes, Jose, it's a pleasure to hear you on stage, understanding that you have a project underway and that you're building a facility in Fundão, Castelo Branco. It's a very good area for this sort of thing, so good for you. And you said you're inviting people to sit for lunch, so where are we having lunch?
See you later at the door.
Okay, perfect, thank you.
Just come with us.
Muchísimas gracias.
De nada.
Okay, now you have your lunch agreed. Any other questions? If not, I would say all we need is an applause for the panel. Thank you. And we're about to start the last panel with a round table. And the person who's going to moderate, it's someone I believe you all know, Laura Ramos. With a degree in journalism from the University of Coimbra, Laura Ramos has over 20 years' experience as a journalist. She was also a press officer at the Ministry of Education and started working with cannabis in 2017, directing the documentary Patients, that if you don't know, we highly recommend you to see. She co-founded and is currently the editor-in-chief at Can Reporter and Canadoro magazine, and she's the program curator at PTMC. We will now welcome Laura Ramos, but let me just check if all the scenario is ready for Laura and her guests. Are we ready? ¿Estamos? ¿Posso chamar? So, ladies and gentlemen, with us, please welcome Laura Ramos.
Thank you. Posso falar neste, né? Okay. Thank you so much, all of you, for being here today. Those who know me know very well that I don't like to speak in public, so I will try to not forget some things that are important. I want to say a special thank you to all the team and the staff that made this event possible today. Special my partner in crime, Fernando Bandres, that shall be around somewhere. If it was not for Fernando, we wouldn't be here today, because he is the one in charge for pretty much everything, really. So I want to thank as well to our amazing speakers and to the sponsors that made this event viable and kept us away from bankruptcy. Thank you for believing in PTMC, and we hope to see you again in the near future. Our PTMC family is growing. This year we didn't have as much people as we expected, but maybe next time, and we are very happy to count on you sometimes, and I really believe this, less is more, and we are more than enough to do this amazing networking and keep the industry and the movement of cannabis going forward. So I must say, thank you. I must say I really feel very thankful for these little pieces of history that we are writing together. We have been here since 2018, and I think we will keep on going, because what we do with passion, and we love what we do, and I'm pretty sure that you all love what you are doing, otherwise you wouldn't be here today. So thank you so much for being here. And let me now introduce you and to say that I couldn't be happier to close the third edition of PTMC with this interesting debate. And I will now introduce you to this debate. Actually, it was defined by Carl Hart. According to Carl Hart, when we talk about legalization, we shouldn't limit the discussion to cannabis, while drugs like cocaine, heroin, MDMA are a bigger problem. Limiting the discussion of adult legalization to cannabis perpetuates misguided notions about cannabis exceptionalism relative to other psychoactive substances. So this debate will open the discussion to new paradigms. Drug reform advocates can no longer elevate one sought-after drug while neglecting others. So to discuss the future of drug reforms, how to regulate the substance use in the 21st century, I am very honored and happy to call Professor Carl Hart from the Columbia University in the New York City. So Carl Hart, okay. Carl Hart is the Ziff Professor of Psychology in the Department of Psychiatry at the Columbia University in New York. And he is also a research scientist at the New York State Psychiatric Institute. Professor Hart is one of the world's prominent experts of the effects of so-called recreational drugs on the human mind and body. Thank you, Carl, for being here with us today. And now I'm happy to introduce you to Teresa Summavielle. She is a principal investigator and research coordinator at the I3S Institute. Thank you, Teresa. She's heading the Addiction Biology Research Group. Her research is focused on a better understanding of the mechanisms involved in addiction and design of new therapeutic approaches. She coordinates courses in addiction in doctoral and master programs at the Medical School of Porto. And since 2008, Teresa coordinates a science-based campaign to prevent drug use among high school students. Thank you, Teresa, for accepting this invitation. And last but not least, João Taborda da Gama is a lawyer and founding partner of Gama Gloria, a law firm based in Lisbon. Thank you, João. And advises on the regulation, use, production, and trade of substances in medical, religious, spiritual, and/or recreational contexts. He also advises on all aspects of the cannabis supply chain and is a counsel to organizations advocating for harm reduction and the responsible adult use of cannabis and psychedelics. He is a regular speaker on narcotics regulations and drug policy around the world, and he just published a book called Regulate and Protect Towards a New Drug Policy. João, thank you so much for being here today. Unfortunately, our fourth member, Miguel Costa Matos from the Socialist Party and founder of the Secretary General of the Socialist Youth, tested positive for COVID. So to keep us away from that problem, from COVID, he didn't come today. Unfortunately, maybe next time we will also discuss with him. He presented also a proposal for the legalization of cannabis, and maybe next time we will discuss this with him. Thank you so much, all of you, to participate on this debate. And I would start with you, Carl, because you came from further. When I proposed this debate, actually, because we were organizing this conference on cannabis, I invited you to participate, and you declined my invitation, saying no, because talking only about cannabis, it's not right. We need to talk about the other substances. And then just to tell about this little detail, which I think it's important, I totally agreed with you. That's why we opened the debate to all the substances, and I think it will be more interesting. So what has been your experience with drugs in general? Can you tell us more about it?
Yes. I didn't realize you were going to use my words against me.
Sorry.
Just so the audience knows, I've been studying psychoactive substances since about 1989. So we're talking about 33 years or so, and been studying psychoactive substances in people since about 98. That is, we bring people into the lab and then we give them a variety of substances to directly study the effects of drugs like cannabis, methamphetamine, cocaine, heroin, a wide range of drugs. And so the sort of the major thing that I take away from all of these years of experiences is that drug effects are predictable. That is, once you know dose, the setting, the history of the person, route of administration, all of these things, you can predict drug effects fairly easily. But the way we talk about them in public, some drugs, the way we talk about drugs like heroin, the way we talk about drugs like crack cocaine and some other drugs, we talk about them like their effects are unpredictable, as if they are uniquely dangerous. And then we have taken other drugs like cannabis, now the psychedelics, out of the sort of vilified category and made them exceptions, while we continue to marginalize, vilify people who use those other drugs without this community, our community, without saying anything in support of other vilified communities. Being a member of, being a Black American, a group that is stigmatized in the United States, it's difficult for me to be in any space in life with people who are not standing up on behalf of other vilified people. So I can't do that. And so wherever I go in life, I have to attend to whoever is being vilified so I can be there on their behalf. Drugs are not different, and that's my perspective. And so I would just encourage all of us to pay attention to what's happening, what's being said about other drug users. Because just like we lied about cannabis for 100 years or so, we're doing the same thing with other drugs. Just like we recognize that cannabis has therapeutic potential, although that should not be the standard by which we decide whether a drug is legally available. because one of our favorite drugs, alcohol, would never be available. But when we think about therapeutic potential, of course, cocaine has therapeutic potential. Opioid drugs have, they're some of the oldest therapeutic potential, had some of the oldest potential, and we know that. So I implore us not to forget about the lies that were said about cannabis, because they're being said about other drugs currently.
Mm-hmm. You know, in Portugal, we had this experience in 2001. Portugal, exactly because we had a problem with heroin and HIV, we decriminalized all drugs. And actually what happened is that heroin users, they have support from the state. They have vans that help them to change the needles, all these programs that were really amazing to help people with addiction. But at the same time, is that what I feel is that people that used heroin, for instance, they are treated as sick people, the people with special needs and special support, and I think it's great. But at the same time, the cannabis users today are the drug addicts, you know. If you use cannabis, at the end, sometimes you will say, oh, those are the drug addicts. But to talk about this, I want to ask Teresa, what is it? Yeah, sure.
Mike has been, oh, okay. Just one thing about the, I want to be careful that when we talk about various drug uses like heroin, you see people in the public, in the media and so forth, the folks who are using heroin in the popular sort of view are the people who are addicted.
Yeah.
The vast majority of heroin users are like me, not addicted. Like I use heroin, I use a number of these drugs, and but the image is we conflate drug use with drug addiction. Majority of drug users of any drug are not addicted, and so that's one thing we have to keep in mind. I just want to make sure that's clear.
Yeah. When I talked about it, that was really people with problems that needed a special support because they were outside on the streets, you know, like not users but really addicted. So specialized in addiction, Teresa, can you tell us more about your research, the research you do with addiction?
Yeah, I can. Well, what we do in my lab is, as you said, we try to understand better the mechanisms that are acting in the brain, and one of the main questions for us right now is that I will say that for like at least 20 years, all the research going on addiction was really focused on neurons. It had a neurocentric view, as if neurons were the only cells in the brain, which of course is not true. They are not even the majority. So now we are really focused on the other cells in the brain. We are trying to understand the role of these cells and how we can understand the mechanisms regulating mainly the crosstalk between different cells to find new therapeutic approaches. But I would of course agree that when we talk about people using drugs or psychoactive substances, we are talking about like I would say 10% of people that can in fact get addicted to these drugs, and the vast majority won't. And this is very important because in the past, as you said, we changed our law, but we didn't really change the way we look into people that use these drugs, and we still discriminate them. And that is something that I really would like to be able to help changing, which is not easy, let me tell you. And if you ask me if I agree that all drugs should be regulated in the same way that cannabis is probably going to be sooner or later, I would say that in principle, yes, I do agree that an adult that wants to use whatever substances should be able to do that. I agree with that. But then if you ask me, okay, and if someone that is deeply depressed is going to decide to use this let's say cocaine. Is he really deciding that in a free way? I'm not sure, I don't know. And then you can also ask, okay, so do you have mechanisms to distinguish who is going to be able to use all these drugs or not? And I don't think we have the mechanisms that we need to discriminate that in a clear way. And you can also ask me, is that enough?
You make the question
yeah,
and answer.
Yeah. Is that enough to compromise the freedom of all the other the free choice of all the other people that will be able to use these drugs in a more regulated and safe way? Probably not. So what I mean to say is that I still have some inner questions that I couldn't yet decide in which way to go. Although in principle, yes, I accept that all drugs should be regulated and available for adult use. Yeah.
And have you studied already the mechanisms of in the brain of addiction? Why some people get more addicted than others?
Well, there are many factors that contribute, but I think that all of us have a different pattern of receptors and neurotransmitters. That's why we are not all the same, and we think in different ways, and we act in different ways, and we have different behaviors. And of course, if we have these different patterns of receptors and neurotransmitters, then different substances will have different effects in our brain, or slightly different, and some of us will be more likely to become addicted than the others. And some, I would also say that some of us are not at all attracted by experimenting substances of abuse. So we are different, and that's why.
Also, the drugs are different in their profiles. Some drugs are more addictive than others.
Yeah, sure. Yeah, we know that. But I also agree that with the knowledge that we have now, we can easily preview what is going to happen, and we can. It's not unpredictable. What is unpredictable, I would say, is what may happen with these new psychoactive substances that are getting into the market more and more. Not maybe in terms of effects, but in how to treat and prevent the effects of such drugs. But if I can, I think that the really important step so that we can move towards that regulation for all kind of substances will lie on education. We do not educate our young people to live in a world where drugs are present. So we pretend that they are not there, and then they are not able to deal and live in a healthy relationship with these drugs. And I think that we really need to implement programs that help them evaluate risk in a proper way and deal with these drugs in a proper way.
Yeah, and you are doing already this work with the youth to prevent.
I try, but but I think that it needed to be much more coordinated across all schools and all the country, which is not.
Yeah, not easy to do. João, you just wrote a book, Regulate and Protect Towards a New Drug Policy. What would be your ideal scenario of drug regulation as a lawyer?
Okay, so I'm a lawyer. You have two specialists here on the brain and on addiction. So I'm just giving a personal view, and then what I think can be translated to actionable policy in the midterm. That's my perspective. I totally agree with what I read, and that substances should have at least a similar treatment. I don't know if it's the same or not, but a similar treatment. And that, of course, the premise is on what that's based. I totally agree on being more libertarian, individual freedom, or, as you said, a proportionate measures that we cannot forbid something just because a small percentage gets harm or is harmed. We have to protect those, but it's not by prohibiting, when now we know that that prohibition created even more harm than the harm of the substance itself, and that harm was highly disproportional in terms of global North and South, communities, countries, within the countries, genders. So we all know that. That's a fact. So we have to act upon that. It's like a human rights imperative. That's one thing. The second thing that you mentioned is how with this can we do this? So even if we all agree in theory with this, what's the role of each and every one of us, and how to translate that into policy? And one thing that strikes me as an example, a real-life example, is that when I started working with medical cannabis, I had meetings with governments, and like 8 years ago, which seems like an eternity now, and in one of the first meetings, there was like a mid-level public servant. He listened carefully, he had prepared for the meeting, and in the end he said, okay, but my concern is if we license this facility or this operation, it means that one day we'll be doing this for, and he said, marijuana. So he didn't get anything that we was discussing. It was cannabis, it was, and what I want to stress is that sometimes our perception on the information on the other side of policymakers, of decision makers, is very, very not good. So we don't know what they don't know.
Yeah.
So we have to assume that they are at level zero, and we have to educate them. So there's education for the youth and for the use of drugs, but in my work, there's a lot of education. It's very easy that people have wrong perceptions, that's obvious, but there's a lot of things that they do not know. And they are willing to know if you give them information, if you teach them, if you tell them where to look. They have fear, but once they go beyond the fear, they are able to learn, but the level of knowledge about this is very low, because they have other things to take care of. They have other laws to pass, they have COVID to manage, they have things that are easier for them and to get approval from their constituents. So for a number of reasons, ones that are more self-centered than others, it doesn't matter, they have other things in their minds. And therefore there's always a huge step of learning curve. Well, the learning curve is fast. We are here, so in my past life I was a tax law professor, so I would be sitting here at the Chartered Accountant bar to speak about the budget law. Now we are speaking about drug policy. A few years ago we were speaking about only medical cannabis, then we started introducing other uses, adult use of cannabis, and today we are speaking of other drugs. So change happens fast, so it's also fast. My main concern, my doubt, my biggest doubt here is what if policy change should be incremental or sudden. When we decriminalized in 2000, there was discussions, well, I was still at law school, but in speaking to people, there was the discussion if it should be for all drugs or not, but that was a minor discussion because, as Laura said, and Teresa has studied, the thing was HIV and overdose. Data available was not very good, and only after decriminalization data became better, but the decision was made. And although some people argue should do this by phases, it was all drugs at the same time. So I would call that sudden policy change. No one was expecting it, changed, the world got better. The world literally, because then that policy was like translated to other countries. Now when we come to this, where there is more knowledge, and in Portugal, in the context of Portugal, we don't have a huge problem. Of course, there are new psychoactive substances. The European Drug Report came out last week saying that we have one new drug per week. We have Mexican cartels manufacturing amphetamine in Europe. So the landscape is changing in Europe, and that's something to watch for. But there is, we don't have the high numbers of deaths that in the US we are seeing with fentanyl. And I know Carl has specific views on that, and a very interesting analysis of what counts as overdose and not, and that's something also very important to share maybe, but we don't have that. So my doubt is, and I'll finish, is when we broaden the debate about drugs, will we scare the politicians? They say, I can't go to my constituents and say that today's cannabis, but it's also cocaine, is the same. And in my interactions, when I speak to people, the question they always make, this is curious and it's surprising, it's cocaine. It's not heroin, because heroin people, I think, that understand that it can have a quasi-medical, as also you mentioned in your book, Carl, of like people being on that treatment and they have better lives when they are addicted than when with substitutes or with the illicit market, like in Switzerland it happens. But for a politician, a good-willing average politician, he would say, I can't speak about that. That's crazy. They say that's crazy. Even if I agree, it doesn't matter. So how do we don't pretend that we are only speaking about one substance and include informed arguments about a broader debate without scaring or without scaring people? That it's fear. The main reason is fear for my analysis. So that's my doubt. It's a doubt I have every day. And people ask you that. So does this mean that in 2 years we'll be sitting here speaking about MDMA? And it's a very hard question, because if you want to be totally truthful, you have to say, no, we should be speaking about MDMA today. But if you say that, you are alienating probably a bridge that you have to make incremental policy change. So that's my internal doubt. When I think about it, when I write, and when I act on my profession.
Yes?
Can we respond?
Sure.
What's up with the mics? Okay, thank you both. Great comments. I want to start with the issue of incrementalism a bit. So we all have to understand that each of us don't play the same role. We have different roles and we speak to different people. So I want to make sure that's clear. You're talking to politicians. I'm not. I left that a long time ago. I have no faith in politicians. I don't like politicians. Sorry if you're here.
Thank God the politician is not here today.
I want to say, yesterday we had a comment about liberty here, and all of the nations, all of the democratic nations have in their constitution that individuals in their country have this liberty, this right to personal liberty. You have self-determination, you're autonomous, and you have that right. They all say they guarantee that right. Of course, we know that there are problems. We know that. So me as a citizen, me as a responsible citizen, thinking about how we have violated people's liberty simply because they love somebody of the same sex. And so when I think about incrementalism, and we said to those people, for example, you wait, your humanity is not recognized fully yet. Wait until 2020. I think of that as being bullshit. I don't want to ever say that to anyone ever again about their humanity. And so incrementalism, I'd say, I recognize your humanity right now, your autonomy, your liberty. I will fight for your liberty, despite it not being palatable to a politician or someone else. I would feel horrible if someone told me, and what they have, wait, you know, they don't have experience with your color, your race, so wait until they're ready for your humanity to be acknowledged. That's not right. And that's how I feel with drugs, the same way. No incrementalism for me. Recognize people's humanity right now like your constitutions say you do. That's it. And for me. And so in terms of convincing people, the people who I try to convince are citizens, the people who vote, and I try to explain, try to help them to understand, to see people's humanity as their own. And that's where I try to start. So when I think about the issue of cocaine or having some control over people, so like they can't make decisions. clearly, if someone has a co-occurring psychiatric illness, we make sure we help them and deal with them. We don't say that comment with alcohol. You know, it's like you're depressed, oh, no alcohol. We may say it, but we deal with it as a society because there are people in our society who are depressed, who are schizophrenic, they have a number of issues, and we deal with it. Just like we will deal with it with cocaine, just like we will deal with it with any other drug. And the issue of NPSs in Europe, as I hear the language and I see the hysteria about NPSs, it sounds like the United States, where we talk about fentanyl, and we say the Chinese, the Mexicans, all the people we don't like, they're bringing it in our country. And it's the same thing here with NPSs. Every year you see NPSs go up in terms of the numbers that they have gotten from the market. But then when it goes down, no one says anything about that. And then they throw everything into the NPSs, every sort of new drug, even though you have stimulants, you have opioids, you have a wide range of substances. And so the question for me is, why do you have this cat and mouse game? Cat and mouse game being like, you ban one, now you have a new one. Why do you have that? Rather than stop and looking, it's like opioid users are satisfied with heroin, but you have a number of NPSs because people are trying to circumvent the law. So rather than making available pharmaceutical grade with no impurities, something that people seek, like heroin, you force the market to do this. So rather than seeing what's happening and responding rationally, we become more harsh in our sort of penalties. And what we do is we increase even more, we increase the possibility of more NPSs as opposed to being smart about dealing with these substances. And so I think that when we're talking about NPSs, we have to talk about why they're there and what's a smart response rather than this elevation and people patting themselves on their backs because they have identified all of these new NPS and then frightening the public about how dangerous they are. Because many of these psychoactive substances, like I said, they have predictable effects if you know dose and the rest of these sort of things. And so drugs in themselves, the ones that people seek, typically don't have some unique danger. Otherwise, people wouldn't be seeking them in that way.
So in your perspective, Carl, if you could decide, if you were a politician and you could decide what would be the best regulation to all the substances?
Yes, so when we think about regulating substances, we don't have to regulate all the substances in the same way. For example, you might have different requirements in order to access different substances. You might have different age requirements. You might have different competence requirements. Like when you drive an automobile, you have to have some competence. You have to pass a test in order to get access to driving an automobile. So we can think about what sort of route of administrations would you have available for various substances. The society can think about how they would like to do that. So we don't have to do it all in the same way. The goal, and by the way, we don't need to legally regulate all of these substances. We can start with a substance from a class. So like, what is the substance that people are seeking? And then we legally regulate that substance. Like, for example, if you want to, in the United States, fentanyl is available medically. Yeah. It's been available since the 1960s. And we didn't have these problems medically because people know the dose, and we even have it in lollipop formulation for children. And so children with severe pain, of course. The point is that you don't have to like make fentanyl available recreationally or for adult use. You can have heroin be available. That's what people are seeking anyway.
Yeah.
And so that's the point. You don't have to make a wide range of these different drugs in these classes available, just the ones that people are seeking.
Yeah. What about like other drugs that come up every day? I don't know. I see news of new drugs, new substances, and this is for the three of you. How do you see the availability in the illicit markets of drugs, new formulations, new chemical formulas that appear, I don't know, every day, every month, every year we hear about new drugs. How can we regulate them or integrate them or prevent or at least reduce the risks for those who are taken? Carl, you want to begin?
If we think about the catenones, and we can maybe we can look at there's pharmacological evidence and we can see which of the catenones that people are seeking. You don't have to legally regulate each of those. And so when we are saying new drugs are appearing every day, these drugs are largely appearing because people don't have access to the one that they're seeking.
Yeah.
Make sure the one that they're seeking is available, and that will deal with a lot of these problems. Of course, there will be some person who will continue to try and seek something else, but that would be an aberration.
Yeah. Teresa?
I would agree exactly on the same basis. I don't know if I was not very clear when I first mentioned the NPSs, but I really think also that NPSs are a result from not regulating the other drugs. Okay, so if you regulate the ones that we know, the classic ones, the number of people seeking the other ones will be, I guess, very, very low, and the vast majority will go for those that we know. I have no doubts on that. Okay, so I really think that regulating will make this problem not really disappear, but become so residual that wouldn't be a problem anymore. Yeah.
Yeah. João, how do you think with all these new drugs appearing and the approach to the governments, do they want to talk about regulating substances or not?
Well, with the new drugs, I think it's today it's clear that it's new substances are found and developed because it's a conjunction that people don't have access to the drugs they want, and if you look at the numbers, there are like 4 drugs or 4 classes of drugs that people seek, and the rest is minimal in terms of statistics. And the fact that in most countries we don't have an analogy clause, which means that for you to be incarcerated, governments need to have the explicit substance there. So it's a cat and mouse, as Carl was saying, is like tax planning. In the old days, if it's not written there, let's create it there. It's principles of criminal law. So it's the conjunction of these two things. But people, what they want is to change their conscience and feel good or feel less pain or whatever we know that takes people to use drugs. And they would use it with substance they know and love, to paraphrase some book. And they would do it. So it's like it's the market. It's a market-driven. It's a supply side driven more than demand. People don't want something that they don't know. They buy online from a lab they don't know where. If they could get something that could get them the same high or the same effect that they would get with something they know. The problem is that there's this belief that, which is true in terms of criminal law, that you don't go to jail if the substance is not scheduled or listed. Which is fun that, like in the doping, in the sports doping, it's more general clauses, so those substances are caught there, but this is just like academic legal problem. It doesn't matter. The fact is that people go to there because they don't find the intoxicant effect they seek, being it high or low in the substances that are available. So we should keep the conversation on substances that are known, and try to see what is the more convincing requirement to access that we can give people and a society. Carl was mentioning driving. Yes, and driving is a very good example. I use that example sometimes, because then you have different classes of vehicles with different requirements for driving. Yeah. You can drive one car at 16 or 18 depending on the country, but if it's a big truck, you have different requirements. If the truck takes more people, or if it's a passenger bus, it's different requirements. Sometimes you have to do updates on your skills, on what you are doing. And now with technology, so technology is not only good for drug dealers to sell drugs through Concord or Discord or Telegram. It's also good to approach people and probably make them refresh their knowledge in many areas, but also on this. So I think that it's not a one-size-fits-all. And once we can admit that it will not be a one-size-fits-all without fearing of falling into the drug shaming discourse, which can also be very off-putting if you are trying to say that, well, we can have different requirements for different substances, and that's normal in a society, different requirements to access to similar professions, to similar activities, and therefore we can start. I think that's the way to go to that debate. Just one point that listening to what Carl was saying, I also, it struck my mind, is that some cultures, like in Portugal, unlike the US, we don't have, it's not very common to have courts making policy change, which means that in a legal culture country like Portugal and most of Europe, citizens don't have that access to policy change, which is going through courts, and Laura knows this with the patients in medical cannabis, that courts are traditionally very opposed to making themselves the change. It's not like that in Brazil, it's not like that in Canada, it's not like that in Germany, to speak of a European country. Of course, it's not like that in the US, which means that making policy change in a culture and a system like Portugal, like France, like Spain, Italy, you have to engage the people that are writing the law. Now in Portugal we have the possibility of having citizens' initiatives to write laws, which is new, and it's happening. It happened in the right to die, it happened in some areas, so things are changing. It's not only like a hierarchical top-down approach. Now there are some ins into the policy changing, but also I agree that information is very important. People have to know what they are talking about, and things that are very obvious to everyone that reads and writes about this are not obvious to the people. The things that Teresa just mentioned, that most of people that use drugs don't have a drug use problem. People don't know that, don't believe that, / don't want to believe that. Then it's a mix. And you say, but the numbers show this. The UN shows this. The Portuguese CICAD, which is the body of controlling drug use, that takes the people that are found with quantities for personal use, steadily over the years attributes a label that can be discussed, but it's what the law says, that people are dependents or non-dependents, and it's totally the same. It's 90% don't have a drug use problem, 10% have a drug use problem, and that's the more conservative approach, which is made by the system that is in place to apply those laws, So even if that is that, so that's the numbers we have, but people do not know this. What I want to stress here, we all know this in this room, but people out there, they do not know this, and we have to repeat and show and say that we are not lying, and then it's probably psychological reasons behind that, drug use being attributed to minority groups or to counterculture, or people are fear of altering the conscience and what they can mean to themselves. There are various explanations to that. It doesn't matter. We have to deal with that. And even these small examples are very there. So when we haven't discussed here, it's also not very relevant statistically, but psychedelics, your average interlocutor in a policy debate believes that people take one acid of LSD and become crazy for the rest of their life, and that happens in 2022 still, even if we have, like, I don't know, 5 years of intense normalization debate about the use of psychedelics around the world with series, documentaries, journal articles, investment, so from all the sources, but even people like that, so that's very difficult to change, and that's what people are thinking. Even with cannabis, and as Carl mentioned in his previous presentation, in psychosis, the myths are there and are very, they have huge stickiness in the public opinion and in the interlocutors of public opinion, which are policy change makers. One thing I find useful, you asked how we have these conversations. I believe that the more normalized the conversations are, the more the more normal they are. Well, this is of course a tautology, but which means that people understand it's a normal discourse. So yesterday I went on TV speaking about my book, and my kids, they never listen to me on TV, but they're on vacation. Now they say, okay, we want to listen, what's your book about? They asked me. And I said, it's about this. And they wanted to read, it's a very small book. And then they asked me, oh, but, so I have 6 kids, and people often, oh, what do you think if your kids take drugs, take cannabis? They ask me, what do you think if you're, and I always say I prefer that they played Bach on the piano and go on hiking and just have deep, loving, and meaningful relationships. But then there's our real life, and when there's real life, I prefer they make educated choices and they alter their conscience with the least harmful substance. That's what I say, and that's what I really believe. But no one told me this when I was growing up. There was no conversation. But the thing I want to stress is that one of my kids, he's 10, and he said, oh, I think that people take drugs because they find it's funny because it's forbidden.
Oh.
So the forbidden thing. And
yeah.
he went, I never told him about it, we never spoke about that, and he was like, because if it's not forbidden, it was not funny. Funny, that's the word he used. And I said, well, maybe, but we have, I told him we have vodka bottles there near the books, and we are not drinking vodka every time. We just drink when people come, and
yeah.
And I believe that these cultural examples, and Teresa stresses a lot about the culture of a drug and how we know them, is useful. And of course, there are many wrongs and things that went wrong with alcohol. We know about that, and in Portugal is domestic violence, car accidents. So we know that, and I'm not minimizing that, but there's a huge normal use of alcohol, huge, like in all households.
And it's a big problem.
No,
at
but
least
the normal
in Portugal.
use, but I'm saying not the problem use, the normal use. We look at the problem use, but there's a lot of normal use.
Yes.
And we never speak about that because it's not the topic, but we can bring that into the conversation. So that's what I think it's useful. I know there's science behind this, but that's what I found the more difficult is this asymmetry of information and how to have this conversation, this differentiation of drugs without falling into drug shaming in one place, but not falling also in the drug scare that our counterpart may have. So that's my doubt. I also believe that things are moving fast, and that in countries like Portugal, it helps that Germany is having these discussions, that Portugal is a good example, so we are proud that we are, in general, a good example. So Portugal may want to follow the lead to be at least in the group that's leading change in a while, but there are things that didn't go right. So only now we are having, 21 years after, we are having the first safe injection rooms, which is a shame. We don't speak about what went wrong in our drug policy decriminalization, but the fact that we are just having, I think like 2 years ago, the first safe injection rooms fixed, not mobile vans, is a shame when other countries were already having them. So things also go wrong, and we have to learn from what went wrong and not repeat that.
Yeah. So I will open the debate to everyone that wants to make questions. You want to say something, Teresa? Sure.
Just wanted to add a very short story. Because I do these sessions for third-year students on the medical school, and I do that with a clinical psychologist. And one of the things that we have agreed in from the really beginning is that all the clinical cases will be about people that they would identify with. So they would read the case and feel like this could have been me.
Yeah.
Okay. And in the first year of the COVID crisis, we didn't have that session. It was cancelled. It was just at the start of the crisis, so we didn't have it. And the next year, the director of the faculty called me saying, I'm terrified. The students that didn't have your session last year, they are now in the 4th year, and they don't have any kind of sympathetic attitude towards the people that have drug problems. They are only sympathetic towards the families.
No.
So I think this is really important
Yeah.
to change the way we discriminate, is the way we see people. It could have been any of us.
Yeah.
Yeah.
For sure. So while you get the microphone, there's one person there that wants to ask a question. I was just wanted to make a final question, Carl. Your book recently published, Drug Use for Grown-Ups. Can you just give brief insights on your book for those that don't know it and maybe they can get it after the conference?
Sure. I recently... thank you. No, Drug Use for Grown-Ups, Chasing Liberty in the Land of Fear. This was basically the result of 30-some-odd years doing research, traveling around the world, and the question that you raise in terms of the statistic that the vast majority of people who use any drug do not become addicted. And so this was, in a way, trying to deal with that as well, using myself. Here I take the reader on a tour of my own drug use, of the various classes, me using drugs around the world with people in government, people in business, people in academia, just a wide range of people who are respectable people, who you don't know they use because they are in the closet. They are cowardly about their drug use, and we understand why. But in the book, I implore people to get out of the closet, because as long as you stay in the closet, you allow other people who don't have your social capital to be vilified and marginalized. And so I tried to be an example of someone who uses drugs but is productive in society, raises his kids, 4 kids, and continues to be a university professor, publishes extensively, all of these things. But yeah, I use drugs. It's like saying, the point is, it's like my drug use has nothing to do with my productivity. It's like saying, oh, you have sexual intercourse. So you have sexual intercourse in this way, so therefore you can't have that job. It's ridiculous, but that's what we do with drugs.
Yeah. Alfredo.
Hello, 1, 2, 3. Now it's good. Thank you for this conversation. I have a question in particular for Carl, and it is about whether you think that by legalizing cannabis for adult use and even other relatively socially acceptable drugs such as psychedelics, that could mean a lot of harm for users of other drugs, because if we do that without changing the prohibitionist paradigm, there's a risk of solidifying this idea of good drugs versus bad drugs. And let me give you a very concrete example. This was said by the Ministry of Health of Germany, who is now in charge of cannabis legalization for adult use in Germany. And a few months ago he said, and I'm reading his words translated into English, more and more often the illegally sold street cannabis is being mixed with a new type of heroin that can be smoked. This quickly drives cannabis users into a heroin addiction. So I think here we have a very good example of a country that is trying to be progressive by legalizing cannabis for adult use, yet the Minister of Health, who is also a physician and a professor of public health, is saying this factually incorrect statement that continues to solidify this idea of there's good drugs and bad drugs. What's your opinion about that?
My opinion is that you're being very kind when you describe him as being factually incorrect. I was thinking more along the lines of an idiot, but that's okay. I wrote my chapter on psychedelics in this book deals with this very issue. Mike, I raised concern about the writers who are writing positively about psychedelics on the one hand, while besmirching or vilifying another class of drug on the other hand. I think about in the United States, it may not have come here yet, but in the United States, the media coverage, the television programs, the movies are a lot more positive about psychedelics, and they continue to be harsh about other drugs. And so I've been writing about those things, I've been lecturing about those things in hopes of people, that people would see the hypocrisy, the inconsistency, and would be embarrassed to do that sort of thing. But the statement that you read from this German health minister illustrates that people are not embarrassed by such stupidity. And so I guess the only thing we can do is try to help the public and people to understand these inconsistencies and that these drugs are, they're psychoactive substances. And there are ways to make sure we enhance their safety while minimizing potential problems.
Yeah. One question over there and one here. Please keep it brief because we have 10 minutes.
Not like yesterday, no problem. I wanted to Carl, like, what are those requirements will be like?
We cannot hear you very well.
Sorry, like going further into this discussion, like understanding what the requirements would be like, because this is like a fundamental point.
Now you need to approach the microphone to your mouth.
Can you hear me now?
Yes, please.
Dope. Well, my question is, further in this discussion, what will be the requirements be like? More precisely, like, will the requirements be into the psychological and the morphological realm? Will that be added and should be preferably be had training like we have for guns or for driving? And can you please give us an example?
Just quickly. Yeah, you might have to have, let's say, a license to buy an opioid, and a license saying that you have some understanding about, I don't know, the physical dependency producing effect, and you know how to identify symptoms of constipation, which is a huge issue. You may have to. I haven't really thought about the specifics. Because I think that there are a number of smart people who we can work this out and decide. That's one of the things that I want to be careful about. I don't want to play every position. I want to play the position that I have an expertise in, and I do in pharmacology, and so I can think about what would be appropriate, but then other people also should have some input, so we make the best decision as a society. And you might have differing age requirements. For example, in the US, I think with tobacco, you can purchase tobacco at 18 years old. With alcohol, it's 21. I mean, we may have some issues with that, but it shows some flexibility that we've already exercised.
There is another one.
Hi everyone, so I'll try to be brief. We have to go to lunch. So first and foremost, thank you Laura and Fernando for organizing this amazing conference.
Thank you.
My question was going to be to Miguel, but unfortunately he's not here. But I think João can also help me understand a little bit more of the questions that I have for the future, and just trying to narrow down a little bit more the conversation to Portugal and to cannabis. Obviously, looking back to the progress we've been having over the years with medicinal cannabis, we had the legalization in 2018. We also had the proposal from Bloco de Esquerda for adult use in Portugal, which was voted against by the Socialist Party and the Social Democrat Party. Last year, interestingly enough, we had another proposal from Bloco de Esquerda and also from Iniciativa Liberal for the regulation of this adult use in Portugal, which, interestingly enough, was not voted against the Socialist Party and the Social Democrat Party. Instead, there was a technical discussion and not a vote precisely on that day that it was presented to the Parliament. Then we had another problem because then the government fell, but now we have a Socialist Party back in charge. So, João, my question would be, from your personal point of view, how do you see this drug policy around recreational cannabis happening here in Portugal for the future? What do you think we can all do as companies, patients, all of the stakeholders across the industry? What can we do to help push that forward as well? Especially because we are also seeing all of the movements across Europe already happening. So I think it will also be a matter of time until Portugal also follows with that. So I would just like to understand a little bit more of your perspective on that work.
Okay, thank you for the question. The context, in my opinion, has these three main points. So we have the most pro-cannabis parliament that we've ever had in Portugal. We have 4 political parties that elected members of parliament, which had cannabis adult use on their running programs to parliament. Iniciativa Liberal, Livre, Bloco de Esquerda, and PAN. 4, and they 4 elected members of parliament. The 2 most opposing cannabis parties in the parliament were either vanished, CDS, or wiped down in their representation, which is the Communist Party, very against cannabis liberalization. And the 4th good news is that we have the far right in the parliament, and the far right is totally opposed to cannabis. So it's very good that will make other parties unite against the far right. So with this, we have a socialist majority. The PS was the party that was responsible for the decriminalization in 2000. António Costa, the Prime Minister, was part of that government. The Prime Minister, António Guterres, is now the Secretary General of the United Nations. So I think it's a good alignment that policy change can be made again. The opposition party, the Social Democrats, they have many MPs that are explicitly pro-cannabis regulation. One of them has introduced a project in their own Congress that was approved that cannabis should be regulated, which means that on a parliament level, and this change has to be done through parliament because of many reasons, but formal one, it involves crimes, and therefore it should be made in parliament. The parliament is I think it's ready to discuss that, and we'll discuss that soon. I don't know the result, of course, but it will have for the first time a serious discussion on cannabis policy in the next month. So that's the context. All bills in Portugal must be signed by the president. We have a conservative president. That's something to keep in mind. But that's one part of the answer to the question. The context of what's happening in Europe, it's favorable. Mainly due to Germany, what's happening in Germany, being a socialist, the socialists also being in the coalition in Germany. Our Socialist Party is very connected to the German Socialist Party for historical reasons and for personal reasons. So I believe also that's a sign of hope for cannabis regulation. And the fact that such an economy and country like is German, we know from the Troika years that Portuguese like to follow what the Germans do and sometimes dictate. So in this case, it will be good for everyone that lives in cannabis change policy. And so this is the context. I believe, my personal opinion, and I've said this many times, I believe that medical cannabis companies should stay with medical cannabis business and should not interfere with non-medical cannabis. That's what they are authorized for. That's what Infarmed has authorized them for. That should be their line of business. When policy changes, if laws changes, they should, of course, position themselves as they will or not, as they want or not, in terms of their business models to other cannabis use that are allowed. But companies should only do what is allowed at, of course, at a certain point in time. And that's my advice, which I thought of about a lot, and I think that's the wisest thing that companies should do. Unfortunately, we're not seeing that across the board, and that's detrimental to policy change. I should let that be very clear. Then there's this third question that's related to this one, which is how the supply chain of legalized cannabis is going to be in Europe and in the world. And that's a question of efficiency, of price. That creates other problems, and I'll go to that in the end. But I believe that Europe should have a conversation in the countries that are more ahead in legalizing adult use cannabis and create an efficient supply chain. And in that context, Portugal, with installed capacity of medical grade cannabis, will be and should be, in my opinion, a relevant player for all reasons, not only because it would be good for national economy, but also for more wider arguments like environmental issues. It's more environmental friendly to grow a plant in the south of Portugal than in the north of Holland or in the north of Germany for reasons that are very obvious to everyone, but I believe there will be production in any side. And then the fourth question, which is a debate that we are not used to in Portugal, but Carl has touched on this, and many people have written about it, and Laura in their activism always are pointing out to this, but it's not very common, is what we do in terms of social justice when legalization comes. I also believe it will come. It can be 1 year, 2 years, but it will come. And what we do in terms of social justice. That's not a very common type of discussion we have in Portugal. We tend to believe in a semantic fallacy that everything is very beautiful and goes very well in Portugal. We don't have injustice. We don't have racism. That's the pervasive narrative, which of course it's wrong and it's detrimental. But we have to think of what to do in terms of social justice. And this means self-cultivation, allowing or not, which would mean maybe an economic means to people that were in the context of illicit trade. And there are other reasons, but now I'm concerning with this. And this is not a very easy conversation to have, but if you have small dealers and something becomes legalized, they are losing their income. And this is very counterintuitive. This is not something that no one wants to go live discussing this, but you have to address these problems. What are you doing with communities that were affected with cannabis trade? Maybe we don't have problems like other countries because we have decriminalized 20 years ago. So we don't have today our jails full of young kids from poor neighborhoods or from blacks or whatever. And then there's a problem in Portugal that we don't know the number of we don't know the race profile of the country because there's this interpretation that would be unconstitutional, which of course just increments racism, but that's a different conversation. But we know that these people are especially affected. So I was looking at my Instagram coming here now, and Gulbenkian, the largest cultural foundation, they did a very nice program with having kids or youth from prisons dancing and in opera, and there was, like I was seeing the Instagram story, and half of the kids were blacks, and of course that's it's a huge disproportionate representation of incarcerated people that we have in Portugal. In general, we don't have drug use crimes as per se because it was decriminalized in 2000, but we have adjacent crimes, small traffic, judges that say that's not for personal use and put the kid in jail. And then we have problems with foreign women. 70% of the foreign women that are incarcerated in Portugal have no connection with Portugal, and they were they were carrying drugs. I don't know the name in English. And so it's a huge disproportion of incarcerated populations that we have in Portugal, and we have to, of course, expunge, clean the criminal records, the past criminal records, but we have to also look at these fringes of not personal use, but not the big dealer, and these communities, we have these problems, and we have to look at that. From what I know of Portugal, this will not be written in the law as such. We have some kind of, let's say, state hypocrisy, But we have to do our best that no one forgets about this, even if they don't write it on the law. And this social justice discussion in Portugal is really difficult, from my perspective and from my experience, is really difficult to have. And to begin with, is that people don't want to believe there's a problem of injustice in Portugal. That's very peculiar to Portugal, maybe in other jurisdictions, but we have that. So that conversation also needs to be tended and to have in the context of legalization. But I don't know how to do. I don't know how to do that. I don't know what that means. I think self-cultivation would allow for some part of that. I believe a not very strict regime of licensing of shops would allow more people to open their own shops in their own neighborhoods. I think that even programs of related to the criminal justice system, in a good sense, that would bring back people that know about drugs to work with drugs and to teach about drugs and do that openly. That probably could speed up some of the efforts and some of justice, and that would, in my opinion, should be made with the specific taxes that cannabis will have. Cannabis, so a huge discussion around the world, if you have more a critical point of view in terms of cannabis legalization, is that you are creating a market for big corporations, and that will bring the price down, the price per gram, and so that was even the paper you published. Some of the comments were on that, on some authors in academia. I believe that, from what I know, and maybe because of my background, a way to deal with that is with an excise tax, and excise tax should try to place the price per gram in terms that's not so cheap that access expands to populations that we don't want to, and I'm saying young people, but at the same time doesn't leave the illicit market as is. Mm-hmm. So an excise tax probably can do that, and then, but what I want to now to come to is we should use part of that money and even other money from other taxes to reinvest in this, not also in education, as Teresa is always mentioning, but also to reinvest in these communities. But in Portugal, it's not like in the US, like we've seen the discussion in New York or New Jersey, where these communities are organized, they come forward, they put their agendas. So there's also, it's also more difficult to identify and to see where to apply the money, but I think that should be done, and that discussion is doing, and I know that the NGOs that are working on this have this very present in their minds, but I think it's only a small minority that is aware that this is also a problem that we have to address.
Thank you. We have time for one last question.
Thank you very much. Hello. Thank you for this great talk. I have a bit of a niche with the term adult use. Because it reminds me to pornography first, and then because we're leaving out a big part of users. There are minors, probably from 16 years old until whatever age is adult in each country. So here will be 18, maybe in the States, maybe 21. And I think it's a big group of people that is critical because they are growing and it's a critical age. And what happens in the States with these kids that want to buy and cannot access? They will not be able to access information about it because they will be banned probably from the shops or the dispensaries. So how can we deal with this? Because I think it's a bit hypocritical to, sustain the adult use of cannabis when it's legalized. So what about the kids? Will they be criminalized? Will they have, what will happen with them legally? How do we deal then with these kids that will start using before they are adults?
Just a quick note to say, no, that the last bill presented to the Portuguese Parliament actually 2 weeks ago doesn't say adult use anymore, it says personal use. So I think they are also changing that, but please.
Yeah, there are a number of issues with that adult use nomenclature, but well, your question is really addressing a really, really important issue, and I think that most of us are aware of that problem. It's often we listen to the question if we are going to push the illicit market into the adolescents because they will be left out of the regulated market. And I'm with you, this is a problem, and I don't know if João has any good answer for that. I don't, and that's something that worries me a lot. And other than education and other options for those young kids, I don't know if we are going to be able to protect them from this illicit market that is probably going to focus on them, and that is a fear that I have. I don't know if John, if you want to add something to that.
Just very, very quickly, so I think that adult use, it's a strategic coined term and narrative to try to have a more efficient approval of laws and to deal with the scare of people. It's semantics, it's narrative, it's part of a narrative. I don't know who coined it, but for me that's very obvious. I think with every good intended person in this debate, what we'll never admit but wants is that it happens with the same as of alcohol. We don't want kids to consume alcohol, but if they do, we want them to consume alcohol. That's even if they cannot buy it, but that's manufactured and sold at a store with all the quality approvals, and it does not have methanol or ethanol, and it's not made in a garage. So we admit that spillover from the legal sales can go to the use because we prefer them. We would prefer them to be consuming that kind of cannabis rather than cannabis that's probably laced with synthetic cannabinoids or that they don't know what they are consuming or whatever. So I believe, so answering your question, I think it's semantics, but everyone what wants is that the supply of a quality produce is greater than the supply of something that's uncontrolled, a little bit like what happens with alcohol. In terms of age, I think it was Teresa that I learned this with Teresa in terms of age. Carlos also saying that we have different requirements in age. If science was to write the rules, I even heard once someone explaining to me that it even should be different based on your body size, even on gender, relating to the quantity of water that you have in your neurons and in your brains, but it will never be like that, so we have to have...
Nor should it. No?
Nor should it. No, not like that. No? Okay, so it's maybe I read. So, but there has to be a cutoff age, but you are true, it's quite, it's incoherent that we're saying we want kids to be safer and saying, well, but they cannot access the safe stuff. It's true, it's obvious.
Matter for us. We are trying to inform, educate. So for me, it's very important, the semantics. And I don't want to pass the wrong idea I feel is wrong, because I feel we are just, keeping on the hypocrisy of not legalizing and not giving access to the kids that will use it. It will be forbidden for them, so they will want to use it more. And maybe in the States you have the example already that they ask friends that are older to buy for them, and probably they will buy larger quantities, and they will use it as soon as they can because they cannot take it home. So I don't know, how does it work in the States with the kids?
How does cannabis work with the kids? The kids use in places like they've done a number of surveys in places like Colorado to see if kids use increase as a result of legal regulations, and there hasn't been an increase. I don't. I think about the alcohol example. I mean, it's. I think about driving. We have made these distinctions for children, like we don't allow people to drive legally without being a certain age. What else can you do? Maybe you have a suggestion. I don't know what else a society can do. Obviously, in a place like Colorado, for example, one of the things that they're still doing that's problematic is that they're still arresting kids for cannabis in some cases. And that's a concern, and you don't want that, like was pointed out nicely. So that's the major, we don't want to be overly punitive to those kids who might violate this law, but we have distinctions for children in our society, and I don't see this as being any different. Maybe you sure. Or no, absolutely. I mean, I agree. I mean, in the U.S., for example, I was in the military at 17 and given an M16, so I could kill and be killed, but I couldn't drink alcohol. So that doesn't make any sense. And so maybe we should, absolutely reconsider the age. We should be thinking about all of these things. If you are old enough to be sent into battle, maybe you can have a joint too.
Margarita is a journalist, that's why she is concerned about semantics. Thank you all. We overpassed the time of this round table, and I want to thank you for this interesting debate, and thank you all for being present. Let me just, Carla, I think she has some words to say.
Few words, and the first words are going to call the PTMC staff that is on the room to join this stage, so that I believe we will all take the advantage of this amazing panel and applaud them after 2 days
all
of recognized...
All the team that made this possible, please come here.
This is the reason why all of this happened in such a professional way, with knowledge brought to us worldwide, with wonderful discussions, great speakers, and a really good audience, even if, as Laura said, less is more, but passionate people about this kind of themes. So I don't know if we have all of them here. I guess so. I will ask for all speakers and all the staff that made this possible, Laura and Fernando, as partners in crime, as you said.
Yes, we are.
So a huge round of applause, and thank you so much for your presence in this Congress.
Thank you. And someone was asking about the socks, the cannabis socks going around. And we want to thank Daniela from Insana Flor that brought some chocolates and some cannabis socks to our speakers. And we want to thank Elena from Empology that brought amazing empty. And Kanajin that provided gin for everyone here. You will receive yours, don't worry. And thank you all. And I hope we see you in October. You want to say something?
Yeah,
the cakes of Luis from Six Senses, 6 Sentidos. Thank you so much, Luis, for the little cookies that were cannabis free this time. Thank you.
Thank you. You must have enjoyed it because you stay there.